Welcome to the December 14th, 2021 regular meeting of the Calaveras County Board of Supervisors. Madam Clerk, will you read off the closed session? Item 1.
Closed session for today, December 14th. Item 1, pursuant to Government Code 54956.9D1, conference with legal counsel re existing litigation, County of Calaveras et al. Versus AmerisourceBergen Drug Corporation et al. 117-MD-2801.
Public comment on closed session agenda items or item.
There is no online public comment.
With that, we'll move into closed session. Thank you.
And that link is being sent to me? I hope.
Welcome back to the December 14th, 2021 regular meeting of the Calaveras County Board of Supervisors. Will everyone please stand with me for the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Madam Clerk, can we have a report out on closed session, please?
Report of closed session for today, December 14th. Item 1, pursuant to Government Code 54956.9D1, conference with legal counsel re existing litigation, County of Calaveras et al. Versus AmerisourceBergen Drug Corporation et al. 117-MD-2804. Board action, no reportable action taken.
Thank you very much. Staff announcements. This is a time for county staff to provide updates of upcoming county events that may be of interest to the public. Ms. Von Lotta.
Good morning, Mr. Chair, members of the board, Crystal Valletta from the administrative office. I just wanted to take this moment, given that this is our last board meeting of the year, and looking forward into the next calendar year and fiscal year, to thank you all. I have been delighted and regularly told people how cohesive I feel like this board has been, certainly during my tenure here at the county. And I think given the incredible challenges that all county staff, who also I would wish to extend much gratitude to, staff, department heads, our partners out in the county who help us with our everyday business and moving things forward. In the face of a second very challenging year in a row, many positive things are in the works and have been happening. We know about strategic planning. We'll hear later today about ARPA. We are moving into a new budget cycle and have potentially on the horizon some very large projects that will stay with this county and move it forward for decades, as opposed to the kind of year-to-year budgeting and whatnot that we've done in the past. And a lot of that will flow from the strategic plan and some once in a generation opportunities that are coming our way with different funding sources. In any event, but it's not just that. It's that I've really seen, and I feel like everyone is coming together and trying to find our commonality, and where we're finding that, moving on those things and actually making some really good progress in the county. So with that, I just want to again thank all of you and all of our department heads, other elected officials and colleagues. And I'm really excited and looking forward to what comes next in the next calendar and fiscal years.
Thank you, Krista. Ms. Medina.
Good morning, Chair Stopper, respective board members, CAO Von Latta, Deputy Clerk of the Board in our Calaveras community, Lisa Medina, Environmental Management Agency. Today I have a few announcements. First of all, I would like to thank our buildings and grounds and our public works teams for helping out our animal shelter services with our Muddy Sally Port located behind our dog runs. They scooped yards of gravel into the area so our animal service team and our volunteers would not get so muddy. So thank you again, team members. If any of our community members need help or need some assistance during this time of year feeding their dogs and cats, we have a little extra to help out with our community due to our community members that have donated plenty of food this year. So we are looking forward to serving you. Please call us at 209-754-6509 if you need that assistance. We are looking forward to an eventful 2022 year at Animal Services. Along with our partners with Focus, our friends of Calaveras Animal Services, and our volunteers and our Animal Services team, we will be having several free rabies and microchip events and several other events as well. Thank you. Please stand by.
Thank you, Ms. Medina. Is there any further staff announcements?
There's no further staff announcement.
Thank you. I'm going to go ahead and hold off on the public health update for a moment and move recognition and acknowledgments ahead of it. Madam Calloway, since you love the search and rescue team and the sheriff's department so much.
I'm going to have a hot flash at that last comment.
I'm sorry.
Yes, search and rescue. I'd like to say that they came out and helped me this morning, but they didn't. I just have a shovel. So I have to just say it is truly my honor to be able to do this. It's a proclamation recognizing Chuck and Donna Hillis's 14 years of dedicated service to the residents of Calaveras as members of the Calaveras Sheriff Search and Rescue Team. Chuck, Donna, could you please come up? What, you think I was going to do this by myself? Donna and I go way back. They're valued. Yes. As I said, I was going to wear my ski outfit. Yeah, I guess I knew it. Whereas the Board of Supervisors and the Calaveras Sheriff's Office are pleased to honor and recognize members of the community that contribute to the well-being and safety of their community. And whereas Chuck and Donna Hillis served the county's Sheriff's Search and Rescue Team over 14 years in the capacity of, what's your title? Good, you read this. Go ahead, did you write it? And call-out coordinators, searchers, incident command, and food services. And whereas Chuck and Donna have demonstrated a true passion for service and have been amongst the first call to conduct a telephonic call-out and tracking of responding members when the team was called upon to rescue a person in need. And Chuck and Donna assumed the role of food services for search and rescue team after seeing the need for such services and procured the equipment needed for transportation, preparation, and storage at their own expense. Yeah, lots. Thank you. Chuck and Donna provided food services and rescue incidents for both local and mutual aid resources and have been the sole provider of meals for searchers, which at times required the serving of over 100 meals per meal period. Who did the dishes? Chuck and Donna have been deployed on mutual aid incidents during large-scale wildfires occurring in Northern California and have consistently been ready and willing to assist in mutual aid incidents as needed. Chuck and Donna have exhibited excellent professionalism, tireless commitment while being dedicated to the ideals of the search and rescue team. You have a new building and now you're leaving. Well, repair.
We're not quite.
and have displayed selfless service by volunteering their time, funds, and efforts to faithfully serve persons in need and to further the effectiveness of the whole team. No, thank you. Well, I haven't finished. Here. I did, nothing's there. I need to make sure my colleagues are in agreement with all this. So may I have a motion, Mr. Chair?
Move.
Thank you. Thank you, Ms. Fullendorf, and a second by Mr. Toffenelli.
Okay, motion by Supervisor Follendorf, a second by Supervisor Tuffanelli. Now, be it resolved that the Calaveras Board of Supervisors recognizes Chuck and Donna Hills for their dedication to the residents and visitors of Calaveras and for their service to the state of California during mutual aid incidents over their 14 years of service, and commend them for their dedication to public service and volunteerism. It was passed and adopted by the Board of the County of Calaveras, but we sometimes think of it as the state of Calaveras. And the state of California this 14th day of December 2021.
Marita? Ms. Callaway, I think we should, two things.
To call
Let's-
for the vote.
Yes. Prior to calling the vote, can we have some comment from our other sheriff's officers and everyone else
I
here?
don't know, since I've already screwed up.
It's okay, but we want to give them their opportunity.
Does anybody want to say anything or do anything?
Yes, ma'am.
Thank you, Sheriff.
So as you mentioned before, Chuck and Don's been a huge asset to the Calaveras County Sheriff's Office and the citizens of Calaveras County. Their efforts have not gone unnoticed to the state of California through all the mutual aid efforts, not only going and helping out, but taking care of the mutual aid assets that come here. So this is from the State of California OES Governor's Office of Emergency Services. It's a commendation awarded to Chuck and Donna Hillis, presented in recognition and gratitude for your dedication to the Calaveras County Sheriff's Office Search and Rescue Team and the significant contributions you have made to the team in your 14 years of membership. Your willingness to provide services, assistance, and your commitment to ensure the team's overall logistical readiness and success have been very much appreciated. On behalf of the team, the Sheriff's Office, the citizens of Calaveras County, and the state of California, we thank you for your service, and this is from the state of California.
Thank you. More? You get pizza? This is just a small token of the Sheriff's Office's appreciation for what you folks have done for us tirelessly. You folks have been feeding us and feeding all the people that come around. A plaque was not what was really designed for you folks, so this plaque is a cutting board. Oh, wonderful. So it says Chuck and Donna Hillis for your dedicated service, Calaveras County. Thank you very much. We absolutely appreciate it. More stuff you know what to do with.
Okay.
Sorry, Greg and Tim, why don't you guys come up here so I can get a picture of you guys in here. Maria, Oli, will you come back? There you go. Yeah, you're better. Perfect. Thank you.
Further comments? Ms. Callaway, would you like to call for the vote? Oh, that's right.
I would like to say it's been an honor to work with you guys, and I feel we have one of the most professional certain rescue teams in the state. And I've seen a lot of searchers, and it's been an honor to serve with you guys and work with you.
She said it all.
So let me call for the vote, otherwise you'll have to give that back. Mr. Chair, could you call for the vote, please?
All those in favor?
Aye.
Those opposed? Passes in a 5-0 vote of the board. Thank you very much.
Thank you.
It's been a long time.
So, okay, this is,
Isn't that cool?
Rita?
And thank you, Ms. Calloway. Sorry about both. All right, we'll move to the public health update. Informational item, public health services. Receive an update presentation from staff on COVID-19 novel coronavirus. Ms. Corey Allen.
Good morning, Chair, staff, and members of the board. Corey Allen, your Director of Health and Human Services. Today with me presenting on your COVID update is our newest member of our executive team, which is Marcos Munoz. He's now the Assistant Director of Health and Human Services, and he will be covering the fiscal elements of our presentation today. We also have Colin Rodriguez, our Deputy Director of Public Health. We have your Health Officer, Dr. Renee Ramirez, and of course, your Chief Executive of Mark Twain Medical Center, Doug Archer. So we wanted to give you a robust, complete presentation today to sort of catch us up. So with that, I'm going to share our screen and get us started. All right. So as you can see, let's see, today by the numbers, the total confirmed cases that we've seen with COVID-19 is nearing 4,500. 14 of those are active today and 4 individuals are hospitalized. The eligible population in Calaveras County that's been fully vaccinated is nearing 55%. We've seen 4,377 cases recover and sadly 91 deaths. Now, we are now tracking the percentage of our population ages 5 to 11 who have been fully vaccinated. We are very low. We are at 2.38%. The state of California in that same age group is at 5 times higher, at over 11% vaccinated. The percent of those who are in the ages 12 to 17 years old in Calaveras, we're just shy of 30%. The statewide number is more than double that. So as you can see, we do lag in the volume.
Sent you an email. Okay. Can you put, I don't know where my Word document is. You need to send me and I want to do it. This is mine. Are you?
Someone talking about the Word documents unmuted, so please make sure you're muted while you're...
It happens to the best of us. So contact tracing and investigation, as you remember, this is really where we can see where we're at with the pandemic. So contact trace and investigation is a daily operation. We're being supported by a team from the state of California, and this is to ensure that we stay timely in those outreaches. At the onset of the pandemic, this helped us determine if we were in community spread, and we are so past that point. We can definitely say COVID-19 is here in Calaveras County, and because of that, we won't report further on where the COVID-19 might be coming from, because it is coming from both within and outside of our community. And the reminder we always give is that through vaccine, proper masking, and social distancing, we can start to mitigate that spread. Now, a lot of us are asking questions about this Omicron variant, so today, Dr. Ramirez is going to walk us through some information about that.
Hi, good morning. So what we know about Omicron is we're still learning about it. With regards to infection and spread, it is way more easy for Omicron to spread than the original variant of COVID. With regards to how much more it is that it's likely to spread compared to Delta, we're still learning. What we do know is that it can spread the virus to others, whether people are vaccinated or not vaccinated. Does Omicron cause more severe illness? That jury's still out. Honestly, it's going to take another couple weeks as numbers are spiking throughout the world and within the country. We will then see how it contributes to morbidity and mortality, hospitalizations, and deaths. So will vaccines work against Omicron? So the current vaccines are expected to protect against severe illness, hospitalizations, and death, whether that's due to Omicron or any of the other variants that are out there. However, breakthrough infections are likely to occur. But just like with the other variants, including Delta, we have seen time and time again that vaccines are safe, they're effective, and they're very effective at preventing severe illness, hospitalizations, and death. Other treatments, particularly aimed towards Omicron, we don't have anything just yet. Scientists are still working with regards to the best ways to treat people who have active infections. However, I just want to remind everybody, the best treatment is prevention, because if you don't get the virus, then you don't have to worry about that. With regards to other tools that are available to fight Omicron variant and any of the other variants that are out there, vaccines remain the best public health measure to protect and to slow transmission, and also to reduce the likelihood of new variants emerging. So masks offer protection against all variants as well. And the CDC continues to recommend wearing masks in public indoor settings in areas of substantial higher community transmission, regardless of vaccination status. And tests are another way to find out how this virus is spreading. So if you have symptoms, be sure to get tested. Moving along onto the influenza, we are in flu season, so if you haven't received your flu vaccine yet, now would be a good time. Thankfully, current status of flu rates is at about the baseline of what we would expect to see this year. This is a graph looking at 2017 and projected all the way until next year, and what you'll see is these huge spikes in red in 2017 through 2020. After that time in 2020, we've implemented a large part of these public health safety measures, distancing, masking, testing, and as you can see, those red lines are pretty much below the standard baseline. So this is just an attestament that masking, washing hands, staying home when you're sick, and keeping your distance is effective at not only reducing COVID, but also other viruses. So some key points. Yes, influenza remains low nationally, but it is continuing to increase slightly. The majority of the influenza that we're seeing right now is amongst the young, 5 to 24, and we're seeing influenza A type of infections. There are a number of other what we call influenza-like illnesses or respiratory illnesses that have been upticking in the community, and we're starting to see a lot of other viruses that aren't even necessarily usually common for this time of the year, RSV amongst those. This is a good time to, again, remind everybody an annual flu vaccine is the best way to protect against the flu and its potentially serious complications. And talk to your doctor about any type of antiviral flu drugs that might be used to help treat the flu if you do get sick with it. This is just some data that I printed yesterday from the CDPH. Despite our numbers being low, there have been 3 deaths attributed to the flu in October. We have not seen any outbreaks thus yet. Our labs are yielding a 2.1 positive flu rate. Thankfully, we have not seen any hospitalizations in the state with regards to flu. And our outpatient influenza-like illnesses are at expected levels thus far. So again, flu is low, but it is beginning to increase. Now is a good time to get your flu vaccine. RSV is kind of high unusually for this time of the year.
Thank you so much, Dr. Ramirez. Mr. Archer, did you have anything you wanted to add from a local perspective with our hospital?
Thanks, Corey. Good morning, everybody. So I don't have really too much to add in terms of flu. We've seen a few, but no major hospitalizations. We've seen a little bit more traffic in the ER with flu, but unfortunately, we are seeing a bit of an increase in COVID just this week. This morning, our hospital census is 10, and 5 of those patients are COVID positive. Overall, it's a little, as was mentioned, it's a little lower acuity than what we've seen in the past with the Delta variant, but it has increased the traffic to the ER for sure. So I think, precautionary steps and maintaining discipline with masking and all those things is the right way to go.
Okay. So with that, as you can hear, when we're talking about the impact on our hospital, the state of California has issued brand new guidelines. They will become effective tomorrow, December 15th. They will be in effect until January 15th. And the reason is truly to impact and reduce the weight on our hospital systems. There's 3 elements to the new guidelines. Universal masking in all public indoor locations. This is for all individuals regardless of vaccine status. We also see shortened timeframes for testing of those who are not vaccinated wishing to attend a mega event. A mega event would be a concert venue or any indoor venue with 1,000 people or more. Unvaccinated persons will now have a 1-day window to get an antigen test or a 2-day window to get a PCR test. And the third element is travel. So if you leave the state of California for holiday travel or otherwise, as you return, the expectation and recommendation is that within 3 to 5 days of return, you do submit to a COVID test so that we can ensure we're not bringing any forms of COVID into the state of California. There's been a lot of questions around our vaccine and the access, so what we're going to do is walk you through the timeline of how we've been managing vaccine distribution in Calaveras County since December 2020. From March of this year to mid-August, the Public Health Department with our community partners and some mobile van administered almost 8,700 doses of COVID-19 vaccine, which is incredibly impressive. It was done over 56 clinics. It included community-based vaccine events, a mobile van, which we had for a limited period of time. We had a partnership with Mark Twain Medical and the mass clinics that you saw there at Frogtown and Angels Camp. The access and the availability of the vaccine continually increased. And what we then found is that acceptance of the vaccine plateaued. So fully vaccinated, we are at 53% in Calaveras County. There's misinformation that continues to be spread around the vaccine, and the peak of the demand was in May of 2021 and declined then in June. So pharmacies and our federal partners through the VA and Indian Health Services also have options that continue to penetrate into our community to allow access for those vaccines, and they are being utilized by our residents. In mid-August, that mobile vaccination van was deployed, and it came to our community as we were really a desert for access of services. But what happened was we saw 10 hours a day of support, 6 days a week. We did that until the end of November, and we administered 2,807 doses across 98 clinics through that avenue alone. The average daily vaccinations you can see was about 32 a day, broken out about 3 per hour. And in that time frame, we spent $770,000 to make sure that we had that access. Public health funds were allowed by the California Department of Public Health and the CDC. And right now, that funding has run out, and we are not yet given guidance from CDPH on whether or not any of our funding can shift into that, knowing that we have these other avenues to deliver the service. We're going to go into that fiscal questions that might come from that comment in just a minute. Pediatric vaccines, super important. Those came down from the CDC and CDPH as an expected delivery system through our community, through pediatricians, medical providers, pharmacies. The CDC approved those being issued, and we received our first doses November 17th. Within a day, our partners had them, and we have now administered 140 doses to our 5 to 11-year-olds at this time. So where are we right now? We continue to test and offer testing to our community. Many vaccination options continue to exist. There are 2 sites in Valley Springs, the Health and Wellness and Sunrise Pharmacy. The Tuolumne County Fairgrounds continues to offer dual testing and vaccination. And here in Calaveras, we've got our CVS and Rite Aid partners. Just to get a glimpse as to what's available, on a Thursday, when we called for a Monday appointment, you can see here on the slide, we found 15 in Valley Springs, 27 options in Angels Camp, and that was just at CVS, plus another 25 and 28 in Jackson and Sonora. You go to Rite Aid, we saw another 5 slots and an open time for walk-ins. And what's fascinating is that right now we're really looking at those boosters. We, as of yesterday, have already given 6,800 boosters here in Calaveras County. And since the loss of our van, we've continued to give over 1,000 boosters to our local residents. And those are all happening through those opportunities that are available. So as we transition through this pandemic, I want to remind everyone that for 2 years our staff has been almost completely dedicated to the COVID response, really to make sure that our community can get a hold and move forward through this. But that's meant that we've had to put a lot of public health programs on hold, with the exception of those things that are mandated. But we continue to say that vaccination is the answer, and that is something that each individual can choose. Those vaccinations continue to be available, and right now we're just continuing to seek out opportunities to continue to serve our community through grants, other vaccination efforts, incentivization, and things of that nature. Moving forward, we have made this pivot to now create a COVID response team within public health and give the opportunity for some of our other public health services to rise up and really start to meet that really long-term need. We're seeing a dramatic increase in communicable diseases other than COVID. We have to continue to see and serve families through the California Children's Services, the Child Health and Disability Prevention. We have lead poisoning, car seat safety, the list goes on and on. So COVID vaccination continues to transition to the local healthcare provider system, as is any other standard vaccine. So with that, I do want to remind our community, we continue to have those walk-in testing sites and drive-through testing sites. For the month of December, you can see a smattering of opportunities in Copper, San Andreas, both walk-up and drive-through. And with that, if you do still need to get your booster, please go to myturn.ca.gov. And with this, I want to pose your opportunity to ask questions of our medical team before we shift to the fiscal update.
Ms. Callaway, may I go first? Thank you. Dr. Ramirez, the Omicron variant, the CDC has reported that, this was this weekend that I was hearing this, so things could have changed going the last 3 days, but that 75% of positive tests for it are vaccinated. So, and you're saying we're still finding out the effectiveness or how Omicron's affecting us. So are we waiting on whether we're going to find out how effective the vaccine is against the Omicron variant?
So we do know the Omicron variant and the vaccine is very effective against the Omicron variant. You have to ask yourself, though, what are you talking about in terms of effectiveness? Does effectiveness mean that people are dying and going to the hospital who are vaccinated? No, they're not. The other thing, there's so many elements to this. The people who are vaccinated, are they also more likely to be tested? What we do know is that the vaccine's effectiveness does wane over time, which is why we all recommend boosters. If it's been more than 6 months since you've received your vaccine, then if you're 18 and over, it is recommended that you receive a booster. So these vaccines have now been around for more than 6 months. So there are some people who only got 1 of 2 of the mRNA vaccines, or just a single Johnson & Johnson vaccine. So if you label yourself as vaccinated, and it's been more than 6 months, then yes, you're probably going to get sick again. Just like with the flu, where the flu, you need to get your flu vaccine every year. So to elude that the people who are 75%, who are the people with Omicron variant who are vaccinated, that's only one piece to the puzzle. Again, we do know that the vaccine is safe and effective, and it's most effective if you've had the vaccine within the past 6 months.
Yeah, that brings me to the next point. It seems like, now with the boosters coming forward and that the effective, the 6 month length as opposed to what they originally said, it seems like Groundhog Day. Every time we move 5 yards forward, the goalpost moves 5 yards ahead of us. I don't know when we're going to be able to catch up with this at the rate we're going. Ms. Callaway?
The hard part, but to answer to that question is, we will catch up to it when everybody is on the same page. If we are not all on the same page, it's going to be like a Roomba picking up something that your animal might have left on the carpet. It's just going to continue over and over and over again. If we don't have people that are listening to the advice and not wearing masks, not distancing, not testing, not vaccinating, then this is going to continue.
Thank you, Dr. Ramirez. Ms. Callaway, do you want to follow up on his product on the carpet comment?
No. Mr. Archer, when someone enters the hospital, I'm assuming you test them for COVID. Does that test determine the type of infection that they have, only that they have it?
No, we don't have the capability to test for specific variants, only if you're positive for COVID-19 or negative.
And Mr. Archer, the people that go into the hospital for COVID, what percentage would you say are vaccinated versus unvaccinated?
It's probably 95 to 98% unvaccinated.
Okay. Thank you. Ms. Allen, I think I might have 3 for you. One, from what I thought I heard you say, we don't know if we'll get the medical team back, so it's your staff that is out in the communities doing the testing?
Yes, we continue to test and have continued to do this since the departure of the van, correct?
Okay, and you're doing vaccinations out also with your team?
The vaccinations are shifted to CVS, Rite Aid, and the Health and Wellness Center and other sites, both in Tuolumne and in Amador counties.
Okay. Do you have, since your staff has been mostly shifted to the COVID response, do you have enough staff? I mean, not that I would ever ask a department head that silly question, but do you have
We-
this?
I always appreciate the question, Supervisor Conway, because no, we do not have enough staff. It is virtually impossible to find and recruit nurses, public health nurses, and you can imagine some of the factors that go into that. The world has been somewhat toxic towards those that have been imposing on their sense of well-being around their freedoms. And when we have a pandemic, like the COVID-19 pandemic, our job is to help people recognize those things that they can do in order to mitigate spread. And so there's great impact to people. The pay disparities between working in a hospital setting, working in any other setting than in a public health setting is far greater. So I could go on, but yeah, you've heard me say repeatedly the difficulty in finding epidemiologists and the funding to do that. So thank you for bringing the question up.
And I have one more. On testing, the state's going to shorter time frames, but when I've had a test, it takes usually 3 days. I mean, and that's been fine. But is the capability out there to then reduce the result to 2 days? And 2, is there a mechanism in the county to do rapid testing?
So rapid tests are not made available to local health jurisdictions, and that is why we refer people to see about locating one at their local pharmacy, should there be any. It's just not something that's been put to the local health jurisdictions to have. And the testing window is really only for mega events. Mega events are typically a voluntary participatory activity, so deciding to go to a concert venue, for instance. And so if the state of California and their laboratories do not have the capacity to meet that window, then it really urges people to consider getting vaccinated should they decide to take on those activities.
So when we were at the conference a week or 2 ago, they were doing rapid testing. It didn't seem like you just needed the equipment. Is there a way that's possible for Calaveras?
Yeah, so what that tells me is that the conference holders, the persons that were putting that conference on, took that bill and decided that it was worth that it was a corporate, nonprofit, whatever that entity is, would have made that decision to purchase those tests to allow access to that voluntary event.
So that I understand, but is it such a high expense that we couldn't do that, or in partnership with Mark Twain do that, or with Rite Aid or CVS?
I would need someone else to respond to that. I don't know, Mr. Archer, if you have a sense of what that testing would cost. I did attend a second conference this year where it was so exorbitant that they opted out of doing a rapid test. So I just don't have those dollar figures, but if Director, if you have that.
No, I don't have the cost specifically for that. Yeah.
Corey, I have some insight into this. So a couple of things. One is we in the county, we use the Valencia lab that's located in Southern California. We have created a new system where the tests are actually picked up by the state every day, and so that transportation has increased the return for our tests, so most people are getting them back a lot quicker now. And regarding rapid or antigen tests, the state has decided to utilize those resources for schools and are giving antigen or offering antigen tests to schools. I think it is important to remember that people can still, on their own if they want to, go to places to pick up antigen tests. They can go to Costco, they can go to CVS, they can go to wherever. And if there are always supply chain issues, I think everyone is aware of that. But as far as the state supply, they are deciding to give those to school districts, which I think makes the most sense.
Thank you, Colleen.
Ms. Calloway, can I follow up on that real quick?
Yeah. No, come on, just one more quick. Thank you.
Yeah, no problem. I just want to follow up on that. Ms. Callaway's rapid testing question. Does the ELC enhancing detection funding qualify for that?
We will absolutely answer the questions around ELC funding in just a moment when we're done with our medical questions.
I get that, Ms. Allen. I put the question forward right now. Can you answer it? Is that qualify underneath the ELC enhancing funding?
Marcos Munoz, can you rise up?
Yes, thank you, Chair Stopper. At this moment, I have not looked in to see if that qualifies. We would have to modify our plan and work with the state to see if we can get that approval for something like that.
Okay, thank you. Were you done with your questioning, Ms. Callaway? Okay, any other further questions by board members? We'll go ahead and proceed, Ms. Allen.
Thank you so much. I really appreciate that. And if it's okay with your board, I was going to allow Dr. Ramirez and Mr. Archer to leave the meeting so they can get back to their business, if that's okay. Okay. So with that, I'm going to turn the floor over to Mr. Munoz to go through our fiscal update. Thank you.
Morning, board, members of the public. My name is Marcos Munoz. I'm the Assistant Director here at Calaveras Health and Human Services, and I'll be providing the COVID-19 fiscal update. The purpose of this fiscal update is to provide the board with an overall snapshot on where we are with the funding that has been allocated to us. So here we go. All right, so we have received 2 pots of funding. Both are called ELC. The first was enhancing detection funding. This funding was, the first round was $1,716,379. This was intended for the use in order to detect COVID through testing, data reporting, and contact tracing. One thing to note is this funding was initially allocated prior to there being an approved vaccine, and that's why it is good to know what the intention of it was. Again, it was through testing, data reporting, and contact tracing. The second round of funding we received is ELC expansion funding. We received this in January of 2021. This was in the amount of just under $2.4 million. And one thing to note is this funding was intended to enhance upon the enhancing detection funds, or I should say expand upon the enhancing detection funds, as well as address areas not addressed, and more specifically, the one big change that happened was we now have an approved emergency youth authorization for a vaccine. So next slide, please, Lori. All right, so I'm going to start with the enhancing detection funds. This is the 1.716379. So when we were given the money, we were also told we had specific strategies. And these strategies, along with these strategies, we were provided a specific budget for each strategy. The overall budget we could not modify. However, we could work within each of those budgets to determine our plan. This came along with a 30-month spending period from May 18th, 2020 through November 17th of 2022. And as of right now, we are 69% of the way spent, while we are 62% of the way through the funding period, which means we are on pace to fully expend by November of 2022. Budget modifications are allowed, so we submitted a spending plan. The state does allow us to modify that. Of course, we have to get state approval each time we do that, but it is allowed. So jumping into these strategies, well, what are the strategies? The strategy number 1 is increasing workforce. So in other words, it is increasing staffing surrounding the other strategies. So strategy 4, that is specific to data monitoring and reporting. We also have strategy 5, which is our contact tracing program. And then we have strategy 6, which is essentially engaging with our community partners. It's around health equity. It's around infection prevention, as well as prevention activities and testing. Strategies 2 and 3, Calaveras County did not qualify for those required an actual lab to be in our county, so therefore we did not receive funding for strategies 2 and 3. So here's a quick snapshot of our budget based on categories, what our budget was, what we have spent / encumbered, and what percentage that is to date. So as you can see, we have spent 72% of our salary and benefits budget, and our overall budget amongst all categories, we have spent 69%. So the ELC expansion funds, this is the second round we received, just under $2.4 million. So fiscally, this is not confined to specific strategies. What do I mean by that is in the first round in the enhancement funds, the state gave us a budget. They said, you're given X dollars for your contact tracing program. In this strategy, while we are still confined to strategies, it actually does not box us in on how much we can spend on those strategies. So if I need to allocate more to the contact tracing program, it's up to us, public health, to determine how much of that $2.4 million can go to that strategy. This had a 29.5 month spending period. So as of November 30th, we are 43% of the way spent, and we are 36% of the way through that funding period. One thing to note is the expansion funds, because they came about after the approval of the emergency approval of the vaccine, they were allowed for activities such as vaccination. An example of this is the expenses we incurred at opening the Frogtown site, the mass vaccination clinic. And also with this one, budget modifications are allowed. We are allowed, again, with state approval, to modify our budget and our spend plan. And here is a snapshot of our expansion funding. To date, we are 43% of the way spent through 36% of the funding period. And as you can see on our categories of the salaries and benefits, 39% of the way spent through those. So moving forward, what are our next steps? One, review the budget. Budgets are initially created based on a point in time, and seeing how COVID-19 is fluid, things change, and so we are constantly looking at our budget, making adjustments as necessary, working with the state to get approvals, and that does not change moving forward. We need to continue to review our budget and do that. Additionally, we need to project out needs through June of 2023. That is the funding period of the expansion. While we are on pace to fully expend the funds by June of 2023, that is a straight line projection, but as you know, COVID-19 is fluid. There may be surges, there may be lulls. We have to look at the situation and have contingencies on how to address it if each of those happen. Right now, 73% of our remaining funds are in salaries and benefits, and so we need to project in order to make sure that we have appropriate staffing in order to address this pandemic. So that is the presentation I have today. I am open to any questions surrounding the fiscal update.
That wraps our presentation. We're open to questions.
To follow up on the first question, the LC enhancing funds are more restrictive, but the expansion funding is a little more open to what you can use them for, from what I understand. So could a rapid testing thing be put forward through the expansion funding?
We can definitely explore that option and work with the state to see what the costs are, if it's even available, and if we can get approval. Currently, we have a spend plan, so we would just have to work with the state to modify that spend plan. I'm not sure exactly what the cost is. Again, we would dive into that cost and lay out the pros and cons of moving forward in that direction.
Understood. Also, these funds are able to be used for vaccinations. You said you used part of these for the Frogtown vaccination clinics. So if at any time we want to use a mobile setup again, and the state's not providing direct funds for the mobile setup, this could be a way to backfill that during those times?
We could. The mobile van is roughly $55,000, which is a big chunk of change, so we would have to definitely dive into our budget, see where we can actually extract that funding to move it. Additionally, the mobile van, we currently did not pay for it out of these funds. We used a different pot of funding that had run out, so we are also in talks with the state right now, currently exploring other funding sources that may be used to that, so we don't impact these current budgets. But to answer your question directly, yes, we can definitely explore that route.
I want to clarify, when you say 55,000, that's per week.
Per week, yes, $55,000 per week.
That makes more sense, you know. The chunk of change in the overall picture on $2 million, that adds up quickly. Thank you. Is there Mr. Garamendi? Thank you.
Thank you, Mr. Chair. Thank you both very much for the presentation. Quick question. This comes back to the mobile van. There seems to be some confusion. Didn't we purchase a mobile van?
We do. We did. We do have in the budget a mobile van. Currently, that's in the build stage. We are still awaiting for that the build to be complete. As of this moment, it has not been completed.
That was. I remember we as a board approved that. Which pot of money does that come out of?
That came out of the ELC Enhancing Detection Funds.
So number 2?
That was the first round of funding we received.
Okay. We've got roughly, sorry here, second, Marcos. We've got roughly $400,000 of equipment. Those are capital assets, I'm assuming, to the county.
Yes.
You want to unpack that a little bit, just since we now own it?
Absolutely. So the equipment category in the Enhancing Detection Funds, that was the first round. We have the mobile van that was just discussed. We also have an informatics dashboard, and that is in the Enhancing Detection Funds. In the second round of funding, the expansion funding, that is 2 emergency shelters that were purchased with those dollars, and that sums up the total equipment budget.
Okay, so we got the van, and the van's going to be on our books forever, as long as we can find people to staff it.
Yes.
And that could serve a lot of our communities in the future, pandemic or otherwise. I'm assuming dental clinics, all the other things that public health does, this will be a useful asset.
Yes, it is.
Okay.
If Colin can speak to that.
And the...
Yeah, so thank you for asking about that, Supervisor Garamendi. So the initial intent with the mobile van was obviously to utilize it for the COVID response, but with supply chain issues and different workforce issues that everyone is having, we have ordered the mobile van. We have not received that yet. However, the intention was also that we would utilize that van post-COVID for exactly what you're talking about. We had actually even started a partnership with Mark Twain and Valley Springs Health and Wellness to take the mobile van to all parts of the county and have all sorts of different services available, all of our health education services. Even we even started talking about having the availability to access appointments for folks to be able to get medical and behavioral health care. And so once we get that van, that will help us kind of get back to the work of public health beyond just COVID. And I also wanted to clarify with those 2 emergency shelters, those are drive-through shelters, and those will allow us, they're quite large, and when we will be practicing setting those up soon, and we can invite you all to come and see them, but they will be instrumental in us responding to the next pandemic that happens, or the next flu outbreak, or the next, fill in the blank that happens. So I just wanted to clarify those 2 things.
That's great. I really value that we're, taking this horrible crisis and trying to build for the future as well. And, certainly up in my district, access to health care is always lacking, especially this time of year. And so, assuming we could get the bodies to staff it, that's great to hear. Thank you very much, Colleen. Thank you, Marcus.
Further board questions? Public comment.
Yes, we have Vicki Rinke.
Ms. Ranky.
Yes, hi, good morning. I just have a couple of questions. Unfortunately, one of them has, or maybe both, would be answered best by the doctors, but let me present those two questions. One is, I never heard any discussion of protocol for someone who has been diagnosed with COVID at home. I know what happens when they get to the hospital, so I'd like to have that presented. What is the protocol for people at home with COVID? And then also the vaccination of children. I would also like to see a presentation of the data that supports that children need to be vaccinated. Remember, this is an emergency use vaccination. It's not been proven in children. It could be very dangerous. So I would like that to be presented as well. And some of my other questions were already answered by the questions by the board, so thank you. That's it.
Thank you, Ms. Rankin. We do have Dr. Ramirez here on the call.
The vaccines are safe and effective across all age groups. There is an abundance of data on the CDC website. Number one. Number two, with regards to protocols imply, are you referring to medical care or medical treatment? Because the majority of people who get COVID are able to recover without incident. The vast majority of people do not need to seek medical services, but those people who are infected with COVID, they should remain home and separate themselves from others so that they do not infect other people. And that's when we start talking about quarantine and isolating people. If you do have any questions regarding treatments of COVID, it is best to reach out to your doctor initially as a phone call, because different doctors, different offices, different places have different protocols in place for how they will see and treat patients. Some are done online, virtually with the camera. Some are done in person with proper equipment, personal protective equipment in place.
And then this is Colleen. I just wanted to also add that thank you, Vicki, for those questions. If folks can pick up their phone when our contact tracers and investigators call, one of the things that those folks do is to kind of walk through what the recommendations are in terms of isolating yourself or contacting your primary care provider. They don't give out medical information or guidance because that's really between you and your primary care provider. But if folks can pick up their phones when we call, that's always appreciated also.
Further public comment?
There is no further public comment.
Anybody present that would like to comment or have any questions? With that, I'll bring it back to the board. If there's no questions, I'm going to thank everyone for the... Oh, Mr. Toffanelli.
I do have one question, and I apologize for not asking it earlier. Corey, you and I had a discussion yesterday on the phone about boosters.
Yes.
And we have all these numbers that are vaccinations given to both young and old, some of them dating back starting in January. And it's recommended you get a booster after 6 months. Do we have any figures at all? Is anybody keeping any figures on the number of booster shots? And shouldn't that be added to these numbers as to what percentage we have of people getting booster shots? Does the state keep track of that or any of that information?
Yes, Supervisor Toffanelli, I'll draw your attention to slide 15 in your packet. That's titled COVID-19 Vaccine Timeline, where we are now with boosters, and it does reflect since as of yesterday how many boosters have been given, 6,836, and those are to individuals who identify as living within Calaveras County. And in the month of December, so within 13 days, 1,004 boosters were given.
Can we add that to this front sheet on our next update, the number where we're at booster-wise, I'd appreciate it.
Sure can, thank you.
Further board questions or comments? With that, thank you. The presentation.
Thank you all.
We've done recognitions and acknowledgements already, so I'll move to general public comment. Any item of interest to the public that is within the subject matter jurisdiction of the board and is not posted on the consent or regular agendas may be addressed during the public comment period. California law prohibits the board from taking action on any matter which is not posted on the agenda unless it is determined to be an emergency by the Board of Supervisors. If public comment is completed before the 30-minute allotted time period, the board may immediately move to the next order of business. If public comment is not completed during the allotted time period, it will be continued as the last item of business in order to provide an opportunity for the remainder of comments to be heard.
Good morning. My name is Jennifer. I'm in District 2. I do have a public comment about the overall general presentation of government, and there's like no other answer for any of the things that are presented to us, like through this COVID thing, the fear of not being vaccinated or not getting your booster and all of that stuff. I'm a Christian, and God is in control of all of this. And we have a Bible that gives us instruction about how to take care of our bodies. It even says you are perfectly and wonderfully, fearfully made. And so for us to look for man for answers when it is in our Bibles for comfort and understanding, and to go there in the first 5 books of the Bible, it's all of the commandments that God has given us, the moral law, the 10 commandments of the Bible that it says don't kill anybody, don't lie, don't all that stuff. And that's what government was designed to be. And here in the United States, we're in a place, thank heaven, that our founding fathers recognized that the Bible was the source document. And when they said there should be an understanding every year to come back to the Bible and recognize where the beginning are, where the trust has to come from. There's 365 references of have no fear. And we come to government and we see nothing but fear. And then there is never supposed to be anything more than 10% in taxes taken for government operations. Because the tithe for God is 10%, and we should never do anything dedicated or as an idol more impressive than what God is responsible for. So I look at the numbers that were spent of taxes that was allocated to this COVID response, and how our county, our personnel in our county, which is actually a pretty Christian county, I'm proud to say, we have a lot of people that come to our church, that tax money came from all of the people in the United States that paid taxes. And so we get allotted this chunk of money, and you can't get people to take it. You can't get people to answer the phones when the county health department calls and says we're tracking and tracing. If it says that on my phone, I'm not picking it up. There's such a resistance to government overreach when we should be going back to the Bible. Even in Joshua, it says every year the government should look at the Bible and recognize its function. Its function was written in the first 5 books of the Bible, and God is always superior. God is always the one. So if people get fearful, we should be looking at going to the Word, finding out what He says is to relax. If anybody in the county is looking for a place to get comfort and understanding and relief from all of this fear, come to church. There's people there who are okay, and you can get an understanding of how our bodies were designed to fight this stuff.
Thank you.
Thank you.
Further public comment? Anything online? Oh,
Is this the time, excuse me, is this the time to comment on item 21 or later?
no, and I spelled that out when I read the general public comment thing. It's in the agenda also, Allison. Thank you.
There's no further public online comment.
Very good. Just one more chance. Anybody in the audience have anything that's not on the agenda? With that, I think we'll take a 10-minute break. Welcome back. Before going, we're getting a little feedback. Can we clear that up real quick?
Just as you say that, Sarah comes on.
Are we good? Okay. Prior to going to consent agenda, I want to let everyone know, talking with staff, we've decided to punt item 21, possibly to next year, after January, sometime in January, possibly, time to be determined, for a broader discussion. With that, I'll move on to the consent agenda. Consent agenda items are expected to be routine and non-controversial. They will be acted upon by the board at one time without discussion. Any board member, staff member, or interested party may request removal of an item from the consent agenda for later discussion. Are there any board members that would like to pull any items off the consent agenda? Is there anybody from staff that would like to pull an item? Public?
There are no online public requests.
Okay, and I assume somebody in the audience would speak up if there's an item they would like to pull. So with that, I'll entertain a motion on the entire balance of the consent agenda.
So move.
Thank you, Mr. Garamendi. We have a motion by Mr. Garamendi.
I'll second.
A second by Mr. Toffanelli. All those in favor? Aye. Those opposed? Passes on a 5-0 vote of the board. Regular agenda. Informational item. Economic and Community Development. Receive a presentation by NEO Connect regarding Central Sierra Broadband Roadmap Project. Ms. Galino.
Good morning, Honorable Chair and Board. Kathy Galino, your Economic Development Director. And today I have a presentation from NEO Connect, which is the consultant that the 5-county region, through the Central Sierra Economic Development District, is putting together for our broadband roadmap. And I believe I have both Cole Presbella online as well as Diane Krause. And I would like to go ahead and introduce, I think Cole wanted to say a little something first, so I'll turn it over to him.
Good morning, Board. Chairman Stopper, Cole Prisabella. I am the Director of Innovation and Business Assistance in the County of Tuolumne, the counterpart to Kathy in Tuolumne in Economic Development. Back in June of 2019, the County of Tuolumne, on behalf of the 5-county Central Sierra region, put together an Economic Development Administration grant request for $500,000 as an outcome of the Central Sierra Broadband Conference we had in early 2019 before the pandemic. And one of the biggest things that we found out of that conference was, as a region, the way that we could help the most was to do some sort of broadband action plan and look at our policies and procedures. And so that's what we did with this $500,000 grant. NEO Connect is our primary consultant who will assist, and we received 3 other bids with one other bid selected to do public outreach specifically for the youth and seniors 65 plus in our community that may not have direct broadband access and whose voices typically may not be heard when we're asking questions about broadband. With that, I'm really excited for, feeling a little sick today. Diane, to get started, and thank you.
Thank you, Cole.
Thank you, Cole, and good morning, everybody. My name is Diane Cruz. I'm the CEO of NeoConnect, and as Cole mentioned, we're the consulting firm that was selected to help you all put together a broadband roadmap. And now is a perfect time to be doing this because in response to the pandemic, there is a lot of funding that's available both at the federal and state level for improving broadband services. I have a presentation. Is it possible to put that on the screen, or would you like me to do that? Either way works for me.
Diane, I'll go ahead and stream it for you. I've got it here, just a sec.
Okay, great. So while that's being put up, I think I have 20 minutes, so I'm going to jump into the agenda and what we're going to talk about. So I just want to talk about what activities are underway and give a sense of a timeline for the broadband planning activities. And then I'll be talking about the current broadband landscape in the county, what can be done. And as I mentioned, the timing of this is perfect in that we're hoping to align the needs with the funding opportunities that are becoming available. Could you go to the third slide? Oh, there we are. Okay. So as Cole mentioned, we started the project and kicked it off in September of this year. And some of the foundational work that has been done is we're gathering GIS data on areas that are served with broadband service, are not served, and are underserved. And so we're gathering this information and we're mapping it. We're also mapping key anchor institutions like our national parks and hospitals and schools and government facilities. Most of those, the schools are connected with broadband. However, those institutions are key because they're often the largest broadband users in the county. And we're pulling speed test data and also pulling information on where there's existing fiber optic facilities in the county. We also are identifying then what the current needs are and where those needs are located in the county. And this GIS and mapping data really provides the foundation for us to start desktop engineering on identifying what the capital costs would be to improve broadband service. And that's what we're doing now. So in December, which is our month to now, we're putting together capital cost projections. We will provide these on a district basis. We were somewhat delayed in putting this information together because we were waiting on district maps to be finalized. Now that they are throughout the 5-county region, we're putting together capital cost projections and putting together various levels of investment that the county could consider or that the county could look at potential partnerships to access funding that's available. We anticipate that we'll have a written plan and strategies and our recommendations in the January to February timeframe. As Cole mentioned, there's another firm that has been working with us and is providing outreach activities. We're about to kick off a survey for citizens, and this other firm is focusing on youth and seniors in the 5-county region to gain input from residents and citizens on their current experience of broadband and why it's important and where there are areas that need to be addressed. You can go to the next slide. So what does it look like here in the county? So first of all, before I jump into what the maps are telling us, I need to lay the foundation that often these maps are notoriously incorrect and do not reflect the accurate picture of how bad broadband service is in an area. The maps are notoriously incorrect in that they rely on data that is submitted on a quarterly basis by the existing service providers And the data that they submit is typically on a census block basis, where if there's one address within a census block that they could say has broadband, then they're able to say that the entire census block has broadband. And this is kind of a national discussion. We know that the maps need to be improved, and I think there's a number of things that are underway to try and improve the maps. The other reason why these maps are usually difficult and inaccurate is that the service providers are able to submit that an area is served if it's advertised as served. So rather than what people are actually getting at their homes or businesses in terms of service. California also has a very low bar. So the federal government has a bar of 25 megabits per second in download speeds and 3 megabits per second in upload speeds. And we know that that's a very low bar, and we know that especially if you're working at home and if you have kids attending school at home, and if you're trying to do a video conference with a medical appointment, that standard of 25 by 3 saying that you do have broadband service is an old standard and it needs to be improved. The state of California has a goal where all residents within the state will have access to 100 by 100 megabits per second. And the information that we'll be putting forward is a path to get you to what the gold standard is, which is 1,000 by 1,000 megabits per second in service. We're only seeing broadband demand get larger every year, so the broadband demand is doubling every 1 to 2 years. And especially with stay-at-home orders, 1 month after the pandemic hit, we saw residential broadband service jump by 92% at households. And so these are old standards. I guess the good news is that the mapping data shows that there are a lot of areas that could be improved within the county. If we zoomed in on the mapping data, which I know this map that we're showing on the screen does not provide, but if we zoomed in on the areas that are really severely lacking service, we would see that Porter, West Point, Railroad Flat, those areas, over 30% of the population lacks the low standard of 25 by 3 megabits per second in service, and followed by the Sherman Acres, Dorrington, Big Trees area. Those are also areas that need to improve broadband service. There is 14% of the population in Calaveras that have no broadband service at all. And so, again, we want to try to leapfrog these standards, and at the end of the day, our recommendations will be towards giving you a path towards what's referred to as gigabit service, or 1,000 by 1,000 megabits per second in service. If you can go to the next slide. What can be done? So I often tell counties that there's a large spectrum in terms of what you can do. So as a local government, you could do everything, meaning in the everything plan is every house and every business within the county would get fiber. That's often very expensive, especially in an area of the country where there's undulating terrain, where there's rock, and where there's lots of trees. That's a very expensive plan. So the reason why these areas don't have sufficient broadband is it's hard to do, it's expensive to do. So on one hand, there's the Do Everything plan, which is building fiber to every home and business. And on the other hand, there's a Do Nothing plan, and just leave it up to the existing service providers to improve services. And what I like to recommend and work with various local governments is that there's 100 different, what I call do something plans. And I'm going to walk through a couple of those things that you could do to help improve broadband. One of the biggest things that you can do that is sort of low-hanging fruit and not very expensive is to have good policies in place that are broadband friendly. And I'll talk a little bit more about what those important policies are and what facilitates more broadband infrastructure being done. But I often say too that in creating a roadmap that the service providers can access, and that's the point and the goal of this process, is to not necessarily replace what the existing service providers are doing, but instead facilitate better broadband and better information in working with the service providers, is provide tools that the service providers can use. So things like where do we have existing conduit in the county, where do we have existing fiber, what are the capital improvement plans and roadwork plans that are being anticipated, can we put in conduit when these capital improvement plans are being executed, how can we build what's referred to as middle mile infrastructure. And I often give the association of middle mile infrastructure is in broadband service is very similar to when you're building a water system. You need to have good access to water supply in order to offer water to residents. Same thing with broadband service. Sorry, I'm losing my voice already. Same with broadband service where you need to have good access to internet supply. So internet supply is often where there are major internet data centers. It's often along major highways to build middle mile infrastructure to get access to internet supply. And then last mile infrastructure is often, from the road or a distribution network to the home or to the business. That's often referred to as last mile. And that is where you would build fiber to every home and every business. We've had a lot of success across the country in developing public-private partnerships or private-private partnerships where when you can work with the existing service providers by facilitating them to build out further infrastructure, and you can also work with others. So things like working with the power company or cell phone companies or Caltrans to work together to put broadband infrastructure within your communities. I'll give a great example of a project where we were working in a very similar terrain in Colorado where there were 6 counties that were working together to try to improve broadband. And there wasn't a good business plan to implement fiber because it was low population density. To build fiber to every community within these 6 counties, it would have cost anywhere from $50 to $75 million. There was only one provider, and that one provider's service kept going down. When their network would go down, they would lose cell phone service, they would lose banking, credit card authorizations, emergency services, and there wasn't a good path to try to figure out how to make a business plan work with a $75 million spend. What we ended up doing is we reached out to several power companies that were building fiber between their substations to help with their power management systems. And we convinced the power companies to provide as an in-kind asset fiber to this project to improve broadband. And then that took the cost from $75 million down to 17. And then the various counties grouped together and applied for grant funding. They were awarded funding from EDA and from the state of Colorado to reduce the cost down to $3 million. And so what they ended up doing at the end of the day is building a very robust middle mile fiber infrastructure connecting all of the communities within the 6 counties that would have cost $50 to $75 million. They were able to spend $3 million to build this network. So I'm a big proponent on let's get the power users, if you will, to the table, and let's work on partnerships to work together to improve broadband. And we are hoping to do that in your 5-county region as well. Go to the next slide. So I mentioned that policies are kind of a low-hanging fruit. A good way to improve broadband services that you don't have to spend a lot of money on that. One of the most important policies is a dig once policy or a shadow conduit policy. And that is just essentially when there is work being done in the roadway where either another utility provider is putting in infrastructure or if you're doing any road improvements where you might have an open trench What makes a lot of sense is to just allow for the ability to put in a shadow conduit that would be put in place while the trench is open or while the work is being done or while somebody else is putting in infrastructure. And in our report to you, we'll provide key routes that show where you should look at putting in a shadow conduit, that if there's an opportunity to do so, please do that. It costs anywhere from $25 up to $45 a foot to open up a trench to put in fiber. So $45 a foot is very expensive. If you have an open trench and you can put in conduit, it reduces the cost down to about $5 a foot. And so that's a really key important policy to put in place to help reduce the cost of broadband infrastructure. And one thing that you want to also do is you want to make sure that you have a good budget set aside, that as these opportunities come available, you have the budget available and set aside to put in conduit. And we also need to include the municipalities in this discussions, because it's just as important that the municipalities have this type of policy in place as well. When we provide our deliverable, and we're happy to do it beforehand, we'll provide sample language that you can include as a policy or ordinance that allows you to put in shadow conduit and just pay for the incremental expense of doing so. Next slide, please. So I mentioned, why do we put in good middle mile infrastructure fiber along the major distribution and highways within the county? So it allows us to have access to internet supply, but really more importantly, it reduces the cost to get that internet supply. So internet service providers often will not serve the more remote and rural areas because, number one, they might not have a very good business plan for a return on investment because of low population density or, low population in general. But oftentimes, too, the cost for that backhaul or that cost for that middle mile to access internet supply is based upon a per mileage basis. And so if you've got 100 miles that you have to traverse in order to get access to internet supply, that's a high operating expense for the internet service providers, and then that further complicates their return on investment in their model. And so by putting in middle mile infrastructure, you're reducing that cost for backhaul and transport. One of the good things that the state of California is doing is they have a $6 billion budget for broadband in response to the pandemic, and a large portion of that is going to be working with Caltrans and other stakeholders in the state to put in middle mile infrastructure. Now, they haven't made those announcements yet, but there are plans to potentially look at specific routes. And the next slide has where there's existing middle mile infrastructure and what's possibly being planned. In the region, there is a network that is primarily used for education. It's referred to as the Scenic Fiber Network, and that is a network that connects higher education and K through 12. It's a government and research network that has been put together and has been put in place. And the map that is on the left, where it shows the blue line going through the southern parts of the counties, is a network that Scenic has in place today. And then the red lines are kind of Scenic's wish list, if you will. Going north from Amador County, CDIN has expanded that fiber network north. And the map that's shown on the right is the map that is very similar to the wish list that Scenic has. It is the map that the state is contemplating building middle mile infrastructure. I know some of you are meeting with Caltrans on different projects, and Caltrans will be a key component of this. If there are meetings that are underway, I'd be happy to participate in those meetings with Caltrans and try to, move it up on their priority list in terms of where they could potentially assist in putting in fiber infrastructure. But this is middle mile infrastructure, and this is a good way that you could potentially participate in improving broadband services, is to have discussions with Caltrans and the power company, do joint builds, work with the state in getting middle mile infrastructure out to your communities. Next slide. So I mentioned that there's a lot of funding that's available in response to the pandemic, and this year with the American Rescue Plan Act, over $340 billion is available for broadband funding, and I have provided the different sources and buckets of funding that's available. The EDA has about $3 billion available for broadband. They primarily invest in middle mile infrastructure, and you need to have a good economic development story. I know this program that we're implementing, the roadmap, much has been funded through the EDA for the planning activities. There's also the capital improvement project, and that's another $10 billion that is going to be administered through the Department of Treasury. That will be allocated on a state-by-state basis, and the state of California will have a large portion of that. E-Rate is a program that has traditionally funded schools and higher education for connecting schools and colleges, universities with fiber. That has received an additional $7.2 billion. And then probably the active discussion that you all might be having as your local fiscal recovery fund, counties and local governments can use that funding for water, wastewater, and broadband services. And so that's a resource that the county could potentially use to invest in broadband services. And then there's also money that's set aside for the Native American tribes. Next slide. In addition to the $340 billion that's available, the state has set aside $6 billion, and they have set it aside for various different programs. And then, as you are probably well aware, the infrastructure bill just recently passed, and there's another $65 billion that's set aside for broadband with the infrastructure bill. A lot of that funding, the rules are being written now, and we anticipate that those programs will start being rolled out in the March-April timeframe. And so, as I mentioned, the timing is good on this, and that we plan to have our recommendations to you in the January-February timeframe. We'll have projects, priorities, and associated capital costs, and they'll also provide a list of the various funding programs, what they can be used for, what their due dates are, if you will, for grant funding, and who your potential partners could be in applying for some of that funding that's available. So with that, next slide. I will open it up for any questions that you all might have about what we're doing and what you might see in the January-February timeframe.
Thank you, Diana. Any questions by board members? Ms. Calloway.
Ms. Kraus, I have, could you go to slide 4, please? That's the one with the current environment. Ms. Kraus, what is that area that doesn't show on the legend that looks green, which is probably appropriate?
Okay, so that so areas that are shown in green are areas that are served, meaning they have access to what the state's benchmark is. So served for the state is 10 by 1 megabits per second. And there are not a lot of areas in Calaveras that have service that are served.
Well, we as in the Calaveras board wrote a letter of support to Alpine County to build that middle mile up in that area. We also have a lot of, between communities, Forest Service land, Sierra Pacific land, and I'm wondering, how do we manage providing service to these pockets of communities that are interspersed between the Forest Service and Sierra Pacific Industries?
So, yes, it's tricky. So your question is, how do we serve some of these remote areas? And I will say that a lot of these plans cannot be implemented all at once. It's usually, the analogy is, how do you eat an elephant one bite at a time? What we would recommend and what we'll provide is we'll provide a number of priority areas in the state, so areas that have no service or are not, meeting the 25/3 standard, and then we'll provide recommendations on how to serve those areas and who your partners should be, who you should be talking to help improve services. That is definitely a challenge for some of these areas that are rural and geographically dispersed. As I mentioned, the reason why they don't have good broadband service today is because it's hard to do. It's expensive. So one bite at a time, we would recommend, first of all, having good policies in place so that when there are opportunities that come available, put in conduit. The other is work with Caltrans and the power company on building infrastructure for middle mile, work with the state, continue to provide letters of support to raise the awareness about lack of broadband services in these rural areas. So if the state can invest in middle mile infrastructure that can reach these areas, then it is easier for the service providers to build the last mile services to reach homes and businesses.
So that's assuming undergrounding. I've tried to work with Comcast for many years to service a fairly developed area along the Highway 4 corridor, and it's all overhead. And they're saying there's no return on their investment. So I don't see how this happens without the partnership, as you pointed out earlier, the private sector providers to, otherwise for me it's just more, no offense, more talk.
Sure, yeah, I totally understand that. So I think what we're seeing now is we now have funding that's available. So you're right, there isn't a return on investment that Comcast could pencil out to invest in some of these communities, or really any provider for that matter. And the reason why it doesn't pencil out is the backhaul costs are expensive. We have lack of middle mile fiber infrastructure, and we have geographic disbursement. So homes and businesses are, you might have really low density per mile of households. And so they're right, the service providers don't have an adequate return on investment, and therefore they're not investing in these communities. Grant funding, on the other hand, completely changes the ballgame. So if grant funding is available to serve these areas where we can't get an adequate return on investment, this is the time to invest in those areas. I'll give you sort of some other data points. The last time there was funding available at this type of magnitude in a stimulus program was back in the 2009-2010 timeframe, and there was $7 billion that was set aside for broadband, and the scenic network was actually built with a lot of use of that funding. But $7 billion is just a drop in the bucket in terms of what funding is available now. So this type of funding does not come around very often. I think it's the largest investment that we will be able to access in infrastructure for multiple generations to come. And so I highly recommend that we use this funding that's available to try to improve broadband infrastructure so that most of the capital costs are paid through grant and funding programs. And that way, the service providers will have an adequate return on investment to serve these communities.
Thank you.
Any further board questions? Anything further you would like to proceed with the presentation, or can I call for public comment?
That's all I have. Thank you.
Okay, before I call for public comment, I just want to thank, we've been discussing this for quite some time through the Central Sierra Economic Development Agency, which is a five-county JPA, Amador, Alpine, Tuolumne, Calaveras, Mariposa, and I want to thank Cole. Cole has been picking up and beating the drum for us quite some time. He went and advocated for this is pretty much like a planning grant to move forward so we can put together our plan. I want to thank you, Cole, for the work you've done for all 5 of our counties moving forward on this. This is the first step to be able to acquire and qualify for these funds as we move forward. So with that, I want Ms. Galino.
I just want to share that the beautiful thing about this program when we started with the 5 counties is they actually looked at Calaveras County's Dig Once policy. So we actually used that policy that was developed by our Public Works to establish kind of a pattern and a template for our other counties. So I just want to share that. And thank you, Public Works.
Yes. Public comment.
There is no online public comment.
I'll bring it back to the board for further questions. Mr. Garamendi.
Mr. Chair, not so much a question, but a statement that in addition to this really great work which is going on, which will help us put the roadmap together, RCRC, which we're a member county of, is formed a joint powers association that we're all a part of. We all voted on it, Golden State Connect Authority. I was elected chair of that authority last week, and hopefully we'll be able to get some projects moving. This will allow us to tap into the federal dollars and the state dollars and bring it under that final mile. I like to think of it in terms of Caltrans is doing the highways, we're doing the local roads, we'll let private businesses manage the storefronts. So that's sort of, I think, the approach we're going to take, and we're going to have our organizing meeting first week in January, and hopefully I'll be able to report back on where we're going first.
Excellent, Mr. Garamendi. I look forward to it, and congratulations on your appointment. And
I think.
Well, yeah, it's a heavy load, but I'm really looking forward to seeing a return on some of these taxes we pay with this funding for infrastructure. It's been long needed, and I think, unfortunately, it was COVID that really brought it to light when everyone got sent home and the kids were doing their homework from home, and there's. For example, look, I'm seeing not enough served necessarily on your side of the county, Mr. Garamendi. When I look at that map, where I kind of see that there's points that aren't taken care of, but there's major pockets of population going through Ms. Calloway's district that are going to be addressed. And there was multiple times I was on phones with people there for things other than county business that in the midst of COVID, phones were not doing it, because there was too many people using the towers for data, and there would be drop calls, delayed messages, and in times of emergencies like the snow we had last February, that can really impact a situation. So I just want to say that. Mr. Toffanelli.
I'll have to agree, but I'm one of the 14% where I live, and if you look at the map that was up there, in that whole area there, there's a lot of homes in there that we depend on satellite. I depend on satellite. And when we had the storms over the last couple days, and it just disrupts everything, even phones. So I'm very interested in completing this path, getting what we need so we can go after the funding to take care of these situations. Jack, congratulations. Did you attend that meeting, or did you get it notified by mail that you were now chair?
I attended, and we're 37 counties now, so we're covering a big chunk of the state. And we hope that we'll have there's some great examples of private-public partnerships that have worked doing this. Places like Utah, Bozeman, places that have come together, allowed the government to build this utility to where the people need it. And then, let the private industry serve the special needs of Rancho or Valley Springs as it goes down there. So we'll see how it goes. I'll be happy to report back out as we go along. Hopefully we'll get some things moving.
I believe that's it, unless the supervisor wants to pipe up. I want to thank the presentation, Ms. Galino. I want to thank Diane Cruz. Apologize if I'm butchering your last name, no intention.
It is Cruz.
Cole, I already gave you kudos. That's all you're getting from me. And Krista, thank you. So we'll move on from there.
Great. Thank you, everyone.
Item 18, resolution, economic and community development. Adopt a resolution authorizing the application for and acceptance of Calaveras County location award resulting in revenue of $539,081 for years 2019-20 and 2020-21, with anticipated additional revenue in the amount of $699,784 for years 2021-22, 2022-23, and 2023-24 to be expended by June 30th, 2024, and designate the county administrative officer or his or her designee as the authorized representative for execution of related documents. Ms. Kathy Galino.
Good morning, Chair Stopper, Honorable Board. Kathy Galino, your Economic and Community Development Director. And today I have before you the resolution regarding our application and acceptance for the permanent local housing allocation funds and establish a 5-year plan for how to spend those funds. Should I join as a panelist? No. Oh, no, it's asking me to do stuff. Sorry. So following the 30-day public comment period, which started on November 9th and ended on December 9th, we had received 2 additional comments. One was in writing and one was by voice message. And the comments that we received were basically that they were looking at other alternatives for the funding, whether it be for home modifications for elderly and disabled, rental assistance, housing assistance, and we took those comments in. We also received one phone message, which was for a comment that was about homeless housing and affordability housing, which this program does not contemplate. So it really was a comment that didn't quite fit into this particular program. Based on the information we revised, and Kimball is here to help chat and talk about the plan. But the information that we received helped us refocus on we had 10 eligibility criteria that we were looking at for this permanent local housing allocation, which comes not often, but every 5 years or 10 years we might get an allocation. It comes from funding that's from homes that are sold and purchased here. Funds are set aside under the SB 2 program and then can be allocated to the county for reuse for housing, addressing our housing needs. And I will go ahead and turn it over to Lee Kimball right now, and she can go through our 5-year plan.
Good morning, Lee Kimball, your Housing Programs Manager. So the permanent local housing allocation is a non-competitive formula allocation sourced, as Kathy said, from recording fees. And even though it's in its first 5 years, I would anticipate that we will see it again. The first 2 years of funding have already been collected on behalf of Calaveras County, totaling $539,081. And the total anticipated to be available over the 5-year period is $1.2 million. To receive these funds, we must submit an application with a 5-year plan of how we'll use the funds in any combination from 10 eligible activities. The plan must have gone through a 30-day public comment period, which we completed December 9th, and the plan can be revised without further comment, but it does require a board resolution. And of course, in Calaveras, any changes to the plan we would bring before the board for authorization. After the application is received, the funds that have been collected for Calaveras are sent and are to be deposited in an interest-bearing account, the interest from that account to be used for the authorized activities. Of the 10 eligible activities, staff are recommending the following. Number 7, accessibility modifications for low-income households that are owner-occupied. And number 9, home ownership opportunities through down payment assistance. These recommendations allow Calaveras County to meet 4 of the 44 programs in our housing element. Program H2A to pursue state and federal funding towards meeting housing needs. Program H3F, providing housing opportunity to low-income households. Program H5A, providing funding for down payment assistance. And Program HG3 to provide for reasonable accommodations. And although our recommendations don't meet any of the regional housing need numbers, it does open up supply in 2 areas, one for our most fragile citizens with a housing modification, and the other for workforce housing. Our 5-year plan proposes that we allocate our funds 70% for down payment assistance, 15% for accessibility modification, 10% for technical assistance for helping folks with the application, and 5% for the administrative costs. This will allow us to serve about 125 households, depending on what each application costs, and that's split evenly between the housing modifications and the down payment assistance. Both programs would be offered on a first-come, first-served basis to eligible households. Existing housing staff who are already in process of reviewing and eligibility for our other housing programs and providing technical assistance would be processing these applications. Down payment assistance, sorry for the background noise, will be for households at or below 120% of area median income, which is determined by the household size. So for example, 120% of area median income for a household with 4 persons is $98,040. By HCD standards, this is a moderate income and it's aimed at the workforce. We would be asking to be able to provide up to 50% of down payment or closing cost assistance, and that would hopefully allow our local citizens to be able to compete in a very competitive housing market. Right now, we would still need to develop our outreach plan, but we do have a Civic Sparks in place on housing staff that is there for outreach for all of our other housing programs. And other than that, we need to create the specific forms for applications and reports to get this going. And I will take any questions you have.
Mr. Garamendi, I see you reaching for your button.
Thank you very much, and thank you, Lee. Thank you, Kathy, for bringing this forward. I just want to, we've discussed this offline. I just want to make sure that we're clear that if there are we can make changes to this plan as it currently states with a resolution of this board, correct?
Yes.
Okay, yes.
That is correct.
Got it, in the record. And that these two, the house modification as well as the down payment, DPA, down payment assistance, those are very complex programs to put together, and they haven't been created yet for our county. We will see those before we begin executing that, correct?
That is correct. We'll be bringing back the program, the details, and all the scoping before we move forward in implementing the program.
Because there are organizations that do this. you probably have some pretty good models,
Oh, absolutely.
including Golden State Finance Authority, which we are
Yes.
part of that JPA.
Exactly.
So I just wanted, as long as we're clear with that, then I'm fine. Thanks.
Ms. Callaway.
On the modifications, Area 12 Agency on Aging's been doing it for years, and it's not complicated. I mean, the problem has been finding contractors, because they have to be licensed, willing to do the work. So hopefully this program will offer incentives to them to do that. So thank you for bringing this forward. I'd like to see some stuff getting done versus our continually talking about it. Thank you, Ms. Kimball.
Any further board questions or comments? No? Public comment? No?
There's no online public comment.
I'll bring it back to the board, entertain a motion.
I move the adoption authorizing the application.
Microphone.
Thank you. The application and acceptance of the county's allocation award.
Motion by Supervisor Callaway. Do we have a second?
I'll second it.
A second by Supervisor Garamendi. All those in favor? Aye.
Aye.
Those opposed? Passes on a 5-0 vote of the board. Thank you.
Thank you.
Thank you.
We don't need time to transition to the next item, do we? Okay, good. Because it's human resources instead of economic development and community development. Okay, item 19, resolution, human resources. Adopt a resolution approving modifications to the Calaveras County Public Safety Employees Association, CCPSEA, Memorandum of Understanding for the term December 18th, 2021 to September 30th, 2026. Ms. Judy Hawkins.
Yes, good morning, Mr. Chair, members of the board. Judy Hawkins, Human Resources and Risk Management Director. I am very pleased to bring before you today the resolution adopting the changes to our MOU with CCPSEA. We have a 5-year agreement, and I do want to thank the members of the bargaining team for CCPSEA. This is a long process, back and forth. And Wanda Maddox, Natalie Jackson, Maria Adams, John Robinson, and Elena McManus were wonderful to work with. I also want to thank Nick Marvin from the Human Resources Office. So some of our highlights on our 5-year agreement, we do have a 4% COLA the first pay period after board adoption, and then 3.5% for the 4 years after that. We will also have the split in insurance like we do with all of our other bargaining units, which is a 50-50 split up to 4.9%, a 65-35 split up to 9.9%, and any health insurance increases 10% or greater, we will have an 80-20 split with the county picking up 80%. We are also adding correctional officer uniforms for new hires or transfers into the correctional officer classifications. And I'm happy to answer any questions that the board has.
Thank you, Judy. Do we have any questions by board members? Doesn't look like it, so I'll go ahead and move to public comment.
There's no online public comment.
Thank you. I'll bring it back to the board, entertain a motion.
I'll move this item, Mr. Chair.
Thank you, Mr. Toffenelli. A motion by Supervisor Toffenelli. Do we have a second?
Second.
A second by Supervisor Fullendorf. All those in favor?
Aye.
Aye. Those opposed? Passes on a 5-0 vote of the board.
Thank you, members of the board. And I do want to thank you for your work also in these negotiations.
Thank you, Ms. Hawkins. You're too nice.
I know it's more painful with me than a
Can I
lot
ask
of
her a
others.
question?
Yeah, absolutely, Ms.
Ms.
Keller.
Hawkins, off the sites of, did you have trouble getting out today?
It was an adventure, and in fact, my husband actually had to bring me to work in his four-wheel drive Jeep.
Thanks.
Well, we're glad everyone's here safe so far. Item 20, resolution, Division of Cannabis Control. Adopt a resolution requesting state cannabis cultivation tax reform. Mr. Greg Wayland, sorry.
Good morning, Chairman Stopper, members of the board. Yes, with this item, it's a resolution that would encourage reform for tax rates at the state. As a little bit of background on this, 2021 has been a particularly difficult year for cultivators, among other reasons, weather, and what is apparently a pricing crisis with respect to the dry weight of cannabis flower. And with respect to tax rates, and I first of all want to distinguish that this does not address local taxes. This is a resolution directed to the state regarding state excise taxes. So recently, the tax rates are set to go up. January 1st, 2022. They're looking at a tax rate of $10.08 per ounce. And doing some rough math, there's two different ways to look at how this translates into practical terms for a pound of dry weight cannabis. One would be the net revenue that they would have after those taxes are taken out. And the other is the functional tax rate. So if you take, for example, what we're seeing is what I believe to be $300 to $500 per pound for a single pound of dry weight cannabis. So if you take that and go with the higher figure, just for the sake of this analysis, 500 divided by 16 is $31.25 per ounce. If you take another $10 off just for the state excise tax, that's $21.25 per ounce times 16 is $340 per pound. So what we're seeing and what I've asked for is sort of an estimate on what the price per pound is to produce a pound of cannabis, and it's likely somewhere in the area of $320 per pound. So if you take the $340 net revenue from that pound and compare it with the cost to produce, they're almost on par. So what we're seeing is that the state excise tax is extremely burdensome on cannabis cultivators in our county. And just for the sake of comparing that, for example, to another tax rate, I pulled off data from the California Legislative Analyst's Office just to compare this to what you might see for a tax rate on a pint of beer, for example. They tax at the state level at 2 cents per ounce of drink volume, which works out to be about 32 cents for an $8 beer, which is about 4%. So the tax rate for that single pint of beer is 4%, whereas for cannabis it works out to be closer to about 32% for a pound. And that is outside of whatever they have to spend for their startup costs, which most of our cultivators since May 18th of 2020 have startup costs. All of our permits have been issued in the span of time between May 18th, 2020 and today. So you have startup costs. You have, that would include land acquisition, purchasing rights to apply, other business costs. And in addition to that, you have permitted cultivators who comply with all state laws, including wage laws and environmental laws. And so there's a significant cost of doing business for our local cultivators. And one of the reasons that I brought this item to you today is because the competitive disadvantage that the high state taxes bring into this equation for our permitted cultivators as compared to the black market is pretty staggering. As cited in the resolution, the proposed resolution submitted with this item, we're looking at somewhere around a 77% cost disadvantage for permitted cultivators versus black market cannabis. So that is a pretty hefty difference in cost of doing business. So again, so the purpose of 1795 is to enable the county to issue permits for cultivators who comply with all of our local regulations, comply with state laws, pay taxes that benefit the general fund and local interests, as well as providing safe work environments and protecting the environment versus what you may see in a black market cannabis cultivation site. So it was important to us to be able to bring this to you today. We think that it's a worthwhile statement to make to the state, and being able to give some relief in a way that makes sense for our local cultivators. So it's our recommendation that the board adopt this resolution. Alternatively, I'm happy to make any changes that you think are helpful or answer any questions you have.
Board member questions. Mr. Toffanelli.
I'll say something about this. What's written here, I don't think this is the problem, Greg. I think if you want to make some difference here, is send a letter to the state to crack down on illegal grows. Right now, it's just they bust them, and it's a slap on the hand. They go right back to doing what they're doing. There's no laws out there to throw them in jail or prevent them from going forward doing it again. And the sheriff has spoke on this several times. They can't even take the pots, or if it's an inside grow, the pots, the overhead lights, anything. So they just take plants and they take the guys to jail, release them, and they go back to what they were doing. There's no laws. I think the letter needs addressed to the state to do something about the laws on this industry and the illegal industry that's going on, not the tax. That's the real issue, is they refuse to do anything on the illegal grows. And give the sheriff's office or police departments some weapons to be able to prevent this going once they're busted. That's the real issue. So I don't think I can vote for this based on that until we can send a letter and the laws change within the state to really affect it. I mean, I was in a business and I've never had any fees reduced because of the cost that it was costing me to do business. And they were throwing fees on anything and everything. Buy some paint, 5 gallons of paint, there's fees on that. And those fees kept going up. Never was there reductions on any of it. Even the tariffs for steel coming in here, the cost of steel right now is crazy. And it's preventing any steel industry going forward doing stuff. It's going to wood now because the lumber prices have gone down. So there's a lot of industries out there that are suffering, not just this industry, because of what's happening with COVID and everything else. But the real issue to me is the state laws. They're non-existent for the illegal growers. They just keep going back and back and back and back. And that's what needs to be addressed, in my opinion.
Thank you, Mr. Toffanelli. I see your hand up, Mr. DeBasilio. I'll get to you in a moment. You are talking about a major component of the issue, and I think you're right about the criminal end of it. You know, decriminalization and the state moving people out of jail by decriminalization on multitude ends. There's a meme I saw on Facebook. Has this little boy, and he's sitting there kind of confused, and he's like, "Are you telling me that the fines for growing marijuana illegally are less than what the taxes are for growing it legally?" Someone else also brought up earlier during public comment that, taxes shouldn't be over 10% on any item item when it comes to, anybody in the United States. Well, there's a point to this that Mr. Whalen's was talking about, more so pointing towards the canopy tax and what the effect is on the grower. By the time, the people that are making money off of this are the retail outlets, but at the same time, by the time they stack those taxes up and get to the very end, when it goes off the retail shelf, after January 1st, approximately 50% of gross is what the tax is taking out by the time everything is said and done. That's exponentially worse than most industries. And I would also like to agree with you that there's a lot of other industries that are being taxed and burdened by the state. I think we need to take a stand on all of them, really. I think the state's overstepped to a certain degree from my point of view on every business. I think this would be a first step in the direction. I think we do need to bring up other issues like the criminal side of it, because the state's fueling that from my perspective. They fueled it. Prop 64 was something I voted no on. And that's the reason I didn't support it's not saying I didn't support legalization. I just don't support the state putting forward a proposition that says, look, vote yes on this now, we'll get it right for you later, because they never do. And we need to bring more things forward, like them taxing another supervisor sent me a thing, they're taxing business COVID relief money, the state is, that the feds aren't taxing. The feds gave these businesses this money to help them through, and they said, we're not going to tax you on this. This is supposed to help you out of a bad situation. The state's like, we'll take that money. There's a myriad of issues. I support sending this one forward to the state. I support sending another one forward to the state later, also describing the criminal issues. A point that Ms. Callaway brings up frequently is we don't want a big old long letter because they aren't going to read it. It's going to sit on someone's desk out there. So, one short point and another short point to those degrees. I would hope that the state would, a short letter saying, hey, watch our Board of Supervisors agenda item on video, so that they can see the way we're dealing with it. And, it's just compounded with what we're doing here to try and deal with it. We are giving our sheriff money for the criminal side. The state's not helping out as much with the criminal side as we are in our own county. And I want to give Mr. DeBasilio, our Met team, and all the guys that are working for him kudos, because they do a phenomenal job with what we give them. We give them millions of dollars a year, but they go over and beyond, and they stay busy. They don't stop. They transition to busting indoor growth. So that was a little long-winded, but I have a lot to say on the issue. With that, right now, I just do support this letter as it's stated. I think there needs to be more said, as Mr. Toffanelli said. Mr. DeBasilio, you still have your hand up?
I do, but I can lower it if you'd like. That make you feel better.
Yeah. What's in that?
I just want to kind of chime in here a little bit. I agree with what you just said, but I do agree with Mr. Toffanelli too, in the fact that as I used to have my own business, and I didn't get a break when my business wasn't doing well when it came to taxes. Taxes came whether or not. I'm not opposed to you guys lowering the tax, but I think going more than half of what we were, you were going from 5% down to 2%, that's quite the drop. I feel for the legal growers, because they've been doing a fantastic job. We haven't had any issues. They've been very supportive of
are going after the illegal grows. The other concern that I have is that I noticed that Mr. Whalen put in his paperwork that it was going to end or potentially end in September. The illegal growers are not going to go away in 9 months.
Mr. De Basilio.
Yes, sir.
We're talking the letter to the state asking them to back off their taxes. Just so you're clear, that item 21 is been pushed off to a date to be determined in the future.
Oh, okay. Okay, I'm sorry. I apologize.
It's okay, but some of those points fit within 20. So if you want to stay within those guidelines, I would appreciate it.
I will absolutely do that. I am fully supportive of that letter going to the state, and if there's something that I can do from my end, I will more than certainly be glad to submit a letter also. I guess is the direction I'll go with that then.
That's phenomenal. I think that Mr. Toffanelli, I would support you on moving forward with something to those ends. Is there anything further, Mr. De Basilio?
No, sir. Thank you for your time.
We appreciate it.
I'm sorry I jumped ship on you.
No, it's okay. Hey, I do it all the time. Marita always calls me out on it, though.
There you go. Thank you.
Any further board comments?
Yeah, I will after public comment.
After public comment? Absolutely. We'll go ahead and call public comment.
I may have a completely different point of view on this. This seems like you guys as representatives of the people in Calaveras County, since we've never been able to have a vote, a citizen's vote on whether we not wanted pot in the first place, and now you're going to take a letter representing us that says we want to encourage you to reduce the taxes on these people because we want, as a community in whole, to stand behind our legal growers, which is 66 people out of 44,000 in this county. It irritates me to no end that we have to babysit a specific industry by overlooking everybody else. And look at the restaurants that weren't able to have people in their restaurant, in their dining rooms during COVID. Where did the tax or the letters to encourage the state to reduce the taxes on those people for the property taxes that they weren't able to utilize? What about the cow grower, the animal growers, our sheep and our goats and our cattle? The pricing that ends up coming to the people who have the infrastructure and the, like you were talking about when you had a business, that your startup costs are astronomical, but they don't whine and ask for somebody to take a letter to the state to reduce their taxes. It's just astounding to me that we are babysitting people who have the wherewithal to make decisions of making a right decision to grow here. They have a right decision to make all of their infrastructure. They've said it's okay, I'm going to start my business, even though I have to pay taxes. And now for us to say we want to back them up against the state to reduce their taxes. And the whole financial thing about comparing about the pricing on beer and taxes, it's just nuts to me. When we had the environmental impact report that had all of the documentation that says why we shouldn't have that thing here in the first place, you've all heard it 1,000 times. Everybody says the best opportunity or the best result from this whole environmental impact thing was a ban. And we went ahead and we wrote the ordinances and we're doing it. And now they want special treatment. I'm sorry, I'm upset about this. Have a great afternoon.
Hi, Steve Yothers from Burson. I'd like to know, although this is a resolution for the state, I'd like to know, maybe we should come and think a little bit about closer to home. How would this affect Calaveras County? Would they get less revenue? I think one of the reasons that any business is to make money. They should make money, that's for sure. But if they make more money, then they should pay more taxes. How would this affect the county as far as tax? Does anybody know? Or is this just a state thing? Doesn't have anything to do with the county?
It's the state thing. The thought would be on returns from the state based on those taxes, though, I think is how it would apply with your question, so.
Oh, okay, so the county
The state
itself
never
wouldn't be
seems to
giving-
figure
wouldn't be
that
giving
out,
up
though.
any revenue.
Thank you. Online comment. Assuming that no one else in the audience wants to make a comment at this time.
Vicki Rinke?
Yes, hi, I'm Vicki Ranke. I'd like to just read into the public record the comments that were sent in by Calaveras residents against commercial marijuana. And Crackham is opposed to modifying the state tax rates for marijuana businesses. And so we're asking for a no vote on the resolution. The state of California should not be reducing the tax obligation of marijuana businesses. And the voters of California were told that permitted marijuana business would bring in billions of dollars to the state revenues. To support the elimination of the state cultivation tax would go against the will of the voters. The argument given in the resolution is that high taxes on licensed marijuana businesses is causing the black market to flourish and illegal growth to continue in the state. We find this statement absurd. The state has done nothing to prosecute illegal growth and black market sales. The state does not monitor or audit licensed businesses to verify how much product they produce and where the product is sold. Selling product in the black market is illegal and needs to be prosecuted. The growers went into this business knowing what the tax requirements would be and what their obligation would be to support the state policies. If the market is folding around the marijuana business, then the owners need to make their own decisions on staying open or closed, just as any other business would do, and we respectively submit. So just to tag on to that, it's not the business of our county to advocate for reducing a state tax that goes out to everybody. We need that tax then maybe to get rid of the illegal grows. And if we're advocating that the state doesn't have to collect from these growers anymore, where do you think that money's going to come from? And right now in Calaveras County, it's the taxpayers of Calaveras County that pay for the eradication of illegal marijuana grows, and that should not be. So anyway, I hope that you vote no against this. This is not needed, and to show our county supporting such a notion is wrong. And the people will let you know that it's wrong. So I hope that you will reconsider and vote no. Thank you.
Thank you, Ms. Franke. Further public comment?
Good morning, this is Jennifer Smith. I certainly respect the opinions and understand that when business operators go into a business that they know the expenses and we know what we're signing up for. I think to have a flat tax on any commodity is unsustainable. To have a 30% tax on a commodity at the manufacturing level is unheard of. No other commodity, no other agricultural product is taxed at that sort of rate. The state taxes they're onerous, and they will create the collapse of the industry, of the legal industry, while the traditional market, the unlicensed market, continues to flourish. And it is the lack of ability of our law enforcement, due to lack of funds and lack of time and lack of resources. They don't have the time to eradicate the illegal market. And it is this flourishing illegal market that the state is condoning with these high taxes. At the very minimum, we need to have a gross proceeds tax or a percentage tax that, like the gentleman that did say, When you make money, you pay more taxes. If you're not making money, why are you paying taxes? Why, when we're making less money, are we paying a 30% tax? I can appreciate everybody's opinion on both sides of this matter, but many municipalities across the state are aligned in getting this tax reform changed, this tax changed. Mendocino County passed it last week. The city of Oakland passed it last week. It's on the agenda today in Sonoma. It's on the agenda today in Lake County. This is an important time in the cannabis industry, and if we're going to have a sustainable legal market in Calaveras County, it's important for Calaveras to align with other counties. So with that being said, I hope that we support this resolution. It's one step towards preserving what we've established in the county. Thanks.
Thank you, Ms. Smith. Further public comment?
There is no further online public comment.
Thank you. One last chance for anybody that hasn't made a comment from the audience. With that, I'll bring it back to the board. Any further questions?
I have a comment to make.
Ms. Callaway.
I understand what Ms. Renicky and Supervisor Tuffanelli are saying, but things are not always as simple as we want to make them. That to proceed with the kinds of things they're talking about regarding law enforcement, I would then recommend that our sheriff draft up a letter and for the board's support on those kinds of things regarding law enforcement and the illegal grows. That is a separate issue which I believe all of us could probably support. This issue has to do, in essence, with sustainability of an industry that is growing and changing as we learn about it. I think all of us in the state, cities, counties, the state of California, thought, we had a golden goose and we were going to tax the hell out of it and fine it and fee it and whatever adjective we want to put with it, and the reality is that's not sustainable as we grow and as this market changes. So I just think that we can still deal with the issues that Renicky and Tuffanelli talked about, but it can be done separately from this issue, and I think, as Mr. Stopper said, there'd be board support for something like that. So based on my comments, I would adopt the resolution requesting the state cannabis cultivation tax reform.
Further questions or comments? I'll entertain a motion, unless that was a motion, Ms. Callaway. Okay. A motion by Supervisor Callaway. Do we have a second?
I'll second.
We have a second by Supervisor Garamendi. All those in favor? Aye. Those opposed?
No.
Passes on a 4-1 vote of the board. Item 22, as we're bypassing 21.
Mr. Stopper, Chair Stopper, I'd like to make a comment on 21.
Oh, yes.
I know it's been pulled. I don't support it being pulled. I'm sorry that it wasn't brought to the board so I could have voiced my comments at that time. But if I remember from prior discussions, when we allowed distribution, we did it based on hoping distributors would become involved within Calaveras County. Distributors, item 21, really dealt with also the distributors who are holding the funds for the cultivators. This does not deal with cultivators. And so now we have distributors who are outside the county holding funds for our distributors, for our impacts, our cultivators. And I know, well, we like to put everything together and deal with it in one one big umbrella. I just feel like in this case, we have committed to this industry, and it's complex, and it's fluid, and it's growing, and just like what we just did on item 20, we want to encourage our locals to become distributors, and by not approving and dealing with number 21, it just doesn't do anything to say to our local community, our local cultivators, for as an example, that you can be a distributor and you can have control over the funds. Right now, without that, they don't have control. The distributors hold on to the funds before it helps the cultivators. So I'm disappointed that this item was moved out, and I just want that for the record. Thank you.
Thank you, Ms. Callaway. Item 22, action item. Clerk of the Board of Supervisors, adopt the 2022 Board of Supervisors meeting calendar. Ms. Rebecca Turner.
Hi, I'm Robin Glanville, Rebecca Turner's assistant clerk recorder. I'm presenting this item to you on her behalf. We have presented the board meeting calendar, the recommended calendar for 2022, and I'd like to share it with you right now on the screen if that's okay with the board. Are you able to see the calendar okay?
Yes.
Okay. So we had the scheduled dates listed here, and we did want to get clarification on the third Tuesday of the month as to how you would like those items scheduled. They've previously been study session items or special meeting items. And we were hoping the board could clarify.
I think we already did with a vote to make it regular meetings instead of, so that would be a more substantial change than just clarifying it to you. It's already been clarified.
If I may, just for a moment, so the board did amend our existing ordinance to now call all meetings which we put on this calendar regular meetings. I think that's what you're referring to, Chair Stopper. But if the board still wished to kind of restrict what types of items were or were not agendized by staff on particular meetings, I think that's the type of direction the clerk may be looking for at this point.
Understood. Yes. My apologies. Ms. Glanville, I apologize.
No, not at all. So we are presenting the calendar to you to see if it's acceptable. These dates that we provided, I did want to point out in November, the reason for the single date was due to CSAC being held the November 14th through the 18th. And then we have the Thanksgiving holiday being held the following week.
Hold on, we have a lot of conversations going on in here at one time. Ms. Von Lotta.
Thank you, Chair Stopper. I did wish to request that we move the entire schedule for June up 1 week so that the budget hearings would begin on June 7th. And the rationale for that is due to the fact that there's a conflict with RCRC, Rural County Representatives of California, that takes place that second week of June.
That second week, moving to the first week is what you're suggesting, 7th, 8th, 9th, and 10th instead of the 14th through 17th? Correct. I, for one, if this were to be a poll, Ms. Callaway, I would be in favor of that.
I would be in favor of that. Does that mean we could drop 28th?
If that's the board's direction and we just roll the whole thing forward, then yes, indeed, we would be dropping the 28th.
I'd support that.
Okay. Yes. Mr. Toffenelli is a yes. Ms. Callaway? Yes.
Yes.
All right. The poll says 5-0, yes.
Okay.
I guess I'm not clear. If CSAC meets after Thanksgiving, why aren't we meeting on the 15th of November? Am I missing something?
They changed the dates, I
They
do
did?
believe, but I defer to Ms. Glanville.
CSAC begins the 14th of November through the 18th.
Oh, God, thank you.
That's a change from
That's a
tradition,
change.
because
Yeah,
as long as I've been here, it's been the week after.
yeah.
Yeah, they changed it.
Okay. 14th to the 18th.
Robin, I believe the idea was to take the 28th off.
That's what I wanted to clarify before. Okay, so I'm removing the 28th. Thank you.
So just move the whole June schedule advanced 1 week. Perfect.
Thank you.
Also, just a question. With Thanksgiving, not knowing what our schedule will be like at the end of the year next year, we might have some pertinent things we may need to address, which is always hard at the end of the year with all the holidays. But Thanksgiving's on Thursday and Friday. Why are we taking Tuesday off?
Historically, we haven't scheduled board meetings on that day, but it's at your discretion,
Right.
obviously.
I'm just throwing the question out there. I don't know. It may be that we don't have enough to actually press forward on at that time, but we could always call for a special meeting if it's needed. So
Or on the 29th,
That's now open.
it's open, 29th of November.
right?
Or we can do, I don't know how much staff is gonna like this, but the first, and just do boom, 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 and then have the later part of the month off with the amount of time off that staff takes during that time and other things that happen. Just a thought.
Yeah, no, there's a lot of ways, to metaphorically skin the cat. Not that I would ever do that.
She wasn't paying attention, man.
I've been reprimanded before for
Give you a
saying
wink on
that,
that
so.
one, Rita.
I guess it would be a question, what is the burden on staff for doing a back-to-back?
First
versus
day.
relieving some time for the holidays?
So, this is just my knee-jerk here, but I will note that if we were to do that, that would be 5 board meetings in a row between October 11 and November 8th on a weekly basis. So,
And also, that would be the November election that week,
Oh, yeah.
am I correct?
Yeah.
I do
Never-
believe that.
The 8th is an election day? Okay, for some reason, yeah, it's the second Tuesday.
Yeah, it's the second.
Yes.
It's the second Tuesday, that's correct, Mr. Toffanelli. All right.
Throw that idea out.
Again,
There's a lot of prep by the
the.
clerk's office during that time, so staff's kind of loaded down. All in all, I brought up the question because I just wanted to know. We don't need to necessarily schedule it now, as opposed to if there's something pressing, we could call for a special meeting and do it then. Do it that way if the board so decides. And that way we can just keep that November the way it's written. If the board's okay with that. Ms. Callaway?
Yes.
Yes? Yes? Mr. Gomez, yes, I'm a yes. Ms. Toffenelli and Ms. Fullendorf are yeses. Is there anything further?
Not at this time. Rebecca did want me to mention that November 8th, like you said, is the general election. Not that she's opposed to having a board meeting on that date, but if you did want to change it to a different date, she wouldn't be upset about that either. We're just throwing it out there. That's all.
Historically though, Robin, you mentioned historically we've always met on election day.
Okay.
Right, we get to wear all our vote pins and stickers,
Yes.
I voted, so
Okay, so we're leaving the 8th then, right?
for now.
Okay.
Any further board suggestions or questions? I'll go ahead and go to public comment.
So I apologize, Mr. Chairman. For the third Tuesday, did you guys want to leave it with study session only items, or what was the board kind of thinking they would like to see on those third Tuesdays?
Generally studies session type things, but if there's something pressing, I'm not opposed to having a regular agenda item. They're all labeled regular agendas now, or regular meetings.
Yes.
So I think that opens us up to being a little bit, I'm struggling for a word here, Mr. Toffanelli. It gives us a lot of room to work with.
Flexible.
Thank you. That's exactly what I was looking for, Ms. Callaway.
If I would prefer, I mean, it's fine at regular meetings and we can put other things on there, but I'd prefer to keep that third Tuesday, if we do any study sessions on that third Tuesday, not going to the second or the fourth, but, and then any other agenda items that are regular agenda items can be put on there.
Ms. Callaway?
That's fine.
Mr. Garamendi? I'm in agreement with Mr. Toffanelli also, Ms. Fullendorf. So that's 5 people, yes, study sessions. If there's anything need to be added on it, then we can.
Thank you.
Public comment?
I didn't think so. All right, bring it back to the board.
I'll move this item, Mr. Chair.
A motion by Supervisor Toffanelli.
Second.
A second by Supervisor Callaway. All those in favor?
Aye.
Aye. Those opposed? Passes on a 5-0 vote of the board. Thank you, Ms. Glanville. I appreciate it. Item 23, resolution, administrative office. Adopt a resolution authorizing a loan not to exceed $6,500,000 from the road impact mitigation fee special revenue fund to various disaster recovery funds for cash flow purposes pending reimbursement. Ms. Summer Nicotero and Mr. Robert Packinger.
Good morning, Chair Stopper, members of the board, Summer Nicotero, Assistant CEO. Today I'm bringing forward a resolution to extend the term as well as increase the amount of the RIM loans that were authorized to fund our 2017 and 2019 winter storm disaster recovery projects. The original loan, which was approved by the board in October of 2019, and the amount of $3.2 million expires on December 31st of this year. The request for an extension to June 30th, 2023, as well as an increase in funding of approximately $3.3 million is requested to cover the anticipated delay in the recovery of these funds from FEMA. Our current loan balance of $11.3 million prior to our storm loan draws will be sufficient to cover this increase in loan amount while we await reimbursements. As of today, there are approximately 1.5 in reimbursements that have already been submitted to FEMA, and we're just waiting on those funds to come through. In addition, 5 of our 6 large-scale projects, which are projects over $100,000, are submitted and are being submitted in the next couple of months, and we'll be waiting on approximately $4 million from those submissions. The remaining small projects are on schedule to be complete in the next several months. One final large project, the Railroad South Road project, is awaiting Caltrans approval. This project is scheduled in late spring of 2022 if everything comes through and we're allowed to proceed. Given our current delay of reimbursements of up to 6 months, what? It's not clear.
I can hear you just fine, Ms. Callaway. Something's up with your microphone, Summer.
The microphone's coming, let me see the option to the other one.
Okay.
Let me see if that works. Is this better?
Way better, phenomenal.
Oh, good, okay. Sorry. Do you need me to start over? I can.
Marita's back, you can go ahead.
She's back? All right. Do you want me to start over from the beginning? I don't know how much you could understand.
I was able to understand you, but I'm used to talking gibberish, so.
Okay, I'll just start over so it's clear. I want to make sure everybody has all the information.
Okay.
All right. So I'm bringing forward this resolution to extend the term as well as increase the amount of RIM loans that were authorized to fund our 2017 and 2019 winter storm disaster recovery projects. The original loan, which was approved by the board in October of 2019 in the amount of $3.2 million, is set to expire on December 31st, 2021. This request for an extension to June 30th of 2023, as well as the increase in funding of approximately $3.3 million, is requested to cover the anticipated delay in recovery of funds from FEMA. The current RIM balance of $11.3 million prior to our storm loan draws is sufficient to cover the increase in our loan amount while we await that reimbursement. As of today, there are approximately $1.5 million in reimbursements that have been submitted to FEMA, and we're just waiting for those funds to come in. In addition, we have 5 of our 6 large projects, which are projects over $100,000, that we're waiting on just the last touches, administrative and notices of completion to submit to FEMA. That should be done in the next couple of months. The remaining small projects are scheduled to be completed in the next several months as well. We do have one final large project, the Railroad Flat Road project, which is awaiting Caltrans approval. If everything goes as planned with that project, it's scheduled in late spring of 2022. Given the delays in reimbursements of up to 6 months, depending on, I know we just had a lot of major disasters throughout the country, we generally are in the 6-month window on reimbursements. This extended date will allow sufficient time for all of our funding to be reimbursed. Administration, Public Works, and the Auditor Controller's Office have discussed our cash flow needs, and we all agree that this loan will not impact any other RIM-funded projects. Any questions?
Moving forward with loans from the RIM funds, I understand most of these are for disaster relief, which are fairly stable revenue sources when it comes to getting money back, but I just want to make sure that when we're doing this, we dot all our I's, cross all our T's, because we don't want to mess up, because I want to make sure that we are able to pay that money back to the RIM fund so it can be used in the places it needs to be in the future. Right, regardless, we're going to have to, so hopefully we don't have to take it out of the general fund someplace else. That's the only statement that I have on it, but I trust that we've been taking broad steps to doing all these steps right in the last few years, as opposed to a few things in the past that were done before I was here, so I don't know any details. Mr. Toffenay.
Yes, thank you, Mr. Chair. Part of the concerns that I had, and I saw an email yesterday, was some of these funds are supposed to be meant for the wagon trail project. And my concerns are not getting paid back the amount that we're borrowing here in time that we'll need it for wagon trail project. So have we put that in here, that we understand that those funds are going to be needed for that project that they've been earmarked for?
Yes. So I mentioned that we had spoken with Public Works and the Auditor Controller's Office yesterday, identified a rough quarterly cash flow need for that large project, and we all felt comfortable that we would be able to meet those cash flow needs even with this RIM loan addition.
The other question I have is, since we borrowed $6.5 million and the county's match was only 6.25% for these funds, we are now paying more than 6.25 because we're having to pay the interest on the loaned amount. Does anybody have a figure on the amount of money that we're going to pay from general fund for the 6.5 that we're borrowing from this fund?
So as of right now, I don't have that, but that is something that our office is working on currently.
So obviously,
go ahead.
I'm sorry, Summer, but obviously we're going to be paying more than 6.25% because of this interest payments that we will have to make. And
right.
I'm sure the interest rate may be fixed, but the longer it goes to pay back is the more money it's going to cost us.
That's true.
Okay. Thank you. Thank you for answering the questions I talked to you in your office about earlier today. Thank you.
Thank you for telling me.
For further questions? Public comment.
There's no online public comment.
I'll bring it back to the board. Entertain a motion.
I'll move.
Oh, wait. Yeah, it is a resolution. I just want to make sure. I was looking at the next one that said informational. Okay. A motion by Amanda Fullendorf, Supervisor Fullendorf.
A second.
A second by Supervisor Garamendi. All those in favor? Aye. Those opposed? Passes on a 5-0 vote of the board. With that, it's a little bit after 12. We have 2 items left. We take lunch and come back at 1:30. That's right.
How long will it take Rita to buy me lunch? She owes me lunch.
Enjoy. Thank you. Welcome back to the Tuesday, December 14th, 2021 regular meeting of the Calaveras County Board of Supervisors. We will be moving item 25 ahead of item 24, informational item, administrative office. Receive an update on strategic planning from Municipal Resources Group. Robert Bendorf. It's not Robbie, it's Robert.
Thank you very much for having me, Mr. Chairman, members of the board. Robert Bendorf.
Microphone, hold on a second.
Oh, I'm
We gotta turn the microphone on. Push the
We like
button.
everyone to hear what you have to
Right
say.
there. The red light, when the red light comes on, you're pushing the right button. You hold it down.
There you go. It's good.
You got it.
I've been out of the game too long, so. Again, Mr. Chairman, members of the board, Robert Bendorf, County, working for the, working with you here in Calaveras on behalf of Municipal Resource Group and efforts in strategic planning. So before I start, I wanted to just give you an idea a little bit about what's been happening. The presentation is fairly short this morning, but it's something that I recite often as we go into the throes of strategic planning in different organizations. And I just thought I would just maybe set the stage a little bit of maybe what's to come. So this came from an excerpt of a letter, and it's a board and CEO communicating. And it says, to inspire people to follow you, to commit themselves to your endeavor, to make needed sacrifices, you have to offer an inspiring mission. It doesn't need to be dramatic, but it does need to be meaningful. I think restoring sound, strategic decision-making that looks beyond tomorrow's report will take us a long way toward a mission we can all be proud of. The results will take care of themselves. Reason I tell you that is I'm a big believer that the strategic planning efforts, or any type of planning efforts for the most part in local government, is not just about the Board of Supervisors, your administrator, your department heads, but it really is the whole. And that is all the folks here that are providing a variety of services to your constituents. And then it's also your stakeholders too. And depending on how counties want to begin their strategic planning effort, whether it is with an inward-facing focus or an external-facing focus or both, that it fits really well, that it takes a whole village to make sure it's right. But again, that whole mission or values, strategies, whatever they are, they really have to have a good intent. And without that, then there's really no point to proceed and move forward. So hopefully that's what I can help facilitate for your board here in Calaveras, and we'll get to a good place. Did I press the wrong button or something? Was that me? No. It's off. On my phone. Oh, look at that. Well, I would tell you that I always need good feedback, so that's perfect. All right. So I just have a few tidbits for the board today and anyone else in administration and those maybe that are listening online to give you an idea of where we're at today and sort of the next steps. So as you can see, there it is. So as you can see there in the first slide, working on our strategic planning effort. So some initial steps that we took the opportunity to gather a bunch of strategic planning documents that are currently in existence here in the county, and Krista was nice enough to go over all of those with me in detail, what was adopted or put in front of the board, what was not adopted, and some next steps that had been talked about. But for the most part, relatively short and nothing really set in concrete, if you will, is what I had reviewed. However, I think there's some good starting points there with what has been put forward in the past. But again, we'll be working with everyone to make sure that those are up to date, and it's truly what the county has evolved to today. Maybe the same, maybe a little bit different, maybe a lot different. So, and then in order to get a good sense of where the county, the state of the county, if you will, related to its organization and moving forward, one of the things that I think is critical is doing a climate assessment and just taking a temperature, if you will, of the organization from the elected leaders, definitely ones that are present today, but also the ones that hold the department head roles as well, and your appointed officials, and then a few other folks, as you can see on the list there. So went through and interviewed those folks, including all of you, asked a few basic questions of what your understanding was of the organization today, and what your understanding of what strategic planning should be as we go along this journey, if you will. But a lot of good information, and I can report to your board that not one of your staff members, not one of your colleagues, cut the interview short and said that'll be enough of that, don't want to participate. Everybody was engaged. So Jack got up and left after about 10 minutes, but I had him come back, so. But it was, yeah, it was from all the supervisors that are here, obviously, and administration, the stage was set really well for me to get just incredible feedback from your folks. And that was over roughly a 3-day period where we were able to get that information, assemble it. And what the process is, and what I like doing is, there's a lot that's said in interviews that maybe could last a half hour, 45 minutes, or an hour, or sometimes an hour and a half. And I feel very strongly that it's good to pull out the common themes. You can see where some of that synergy currently exists today throughout the organization. And there were some one-offs that are included in the summary that I have had a chance to prepare and went over with your county administrator, and I'll also be talking with Supervisor Garamendi and Supervisor Fullendorf. I believe you're staying on the strategic planning committee, I'm guessing? Okay. So I'll be working with that committee as well. And in those results, I can tell you, without, I want to respect the committee's process as well, but one of the questions that I pose to board members, administration, and all those interviewed actually is what's going well. And I can tell you that the common themes that I pulled out is that departments do work well together and there are good working relationships. You like those things to evolve over time into good partnerships, right? The working relationships are great. Then they sort of evolve into good partnerships And that's what really makes an organization chug at the end of the day. But there's a general sense of accomplishment and a good feeling of the sense of work when department heads do come together and they work on projects, et cetera. What it lacked a little bit was what I had heard, not much of a sense of celebrating those accomplishments maybe in a grander way. Very positive attitude among department heads and employees, as I picked that up really well. And kudos to your board. A lot of comments about the stability of this board. And not everything's perfect and not everything's painted as a rosy picture, but you've got a good army of folks behind you here in Calaveras. And harnessing those folks is going to be key to success. And I think one of the things that came up that I will just let your board marinate on this a little bit, and they remarked, and one of the common things is, again, this was said by several, including some of the board members, is that while collaboration with the Board of Supervisors exists, that there needs to be more of it. And that was a desire that I received from department heads and others that I interviewed, and also members of the board, is that they would like to see that working relationship grow and evolve into the partnership. So, anyway, just a few tidbits from the interview process. So, next steps. So, be meeting very soon with the committee that we spoke of earlier, and I've met with them, I believe, a couple times so far, Krista? And this will be another one, and we'll discuss timeline and say, okay, this is how everything fits, got the holidays and whatever big items that you folks might have coming up here in Calaveras, we'll make sure we work in concert with those, but we'll be working on that timeline. And then we'll do a little bit more comprehensive review of existing strategic planning documents, not only the ones that are in existence here in Calaveras, but also ones that are similar that maybe identify some best practices. Not word for word type of exercises, but looking at those best practices. So one of the things that we've talked about recently is to make sure everybody is on the same page, that there's a good understanding of what that strategic planning outcome or outcomes would be, if you will, and that is to get folks to work together. And that is a little retreat with the board that's been tentatively scheduled, and then also a retreat with your department heads. In addition to that, in talking with Krista, be coordinating, hopefully, we'll ask for permission, forgiveness, all that other good stuff from the committee, is having not only the committee, which I think is a great place to discuss sort of those next steps and those overarching goals and objectives, but also to involve other folks in the process and have a working group. Because truly the ownership in a strategic plan is not owned by one group. It's not owned by a couple of groups. It should be owned by everyone within your organization. And so having that input from those folks is going to be key. So one of the recommendations that we'll talk about is having a working group. Fairly small, but a working group that can then take to the committee recommendations, next steps, how do things look, how are things progressing, et cetera, and receive direction from that committee to the working group. So, and then we'll also talk about, and circling back with the committee, is stakeholder input. You know, in every county, and I think every organization is a little bit different. Like I explained earlier, on occasion, some of the discussions can be inward facing. And they said, hey, let's start our plan off, and so we have a good set of strategies for our organization that we can achieve. Some say, well, hey, let's get, what the countywide, basically, feels like we should be focusing in on. And then it's a combination of both. Some organizations do a little bit of each. But we'll work through those things, and we'll talk about how that goes. Stakeholder input can be accomplished through a variety of things, whether they're town halls, which has been just a skosh difficult over the last couple of years, unless they're virtual. But there's also really successful, I just did one recently on surveys. And so put a very good, concise survey together for the public, and then do a webinar that accompanies that survey, open it up, and in one county, we had a tremendous response. It was really good, but we advertised it on social media, put it up on the website, it worked out really well. But those are things that we'll be talking about. And there's other mechanisms too to receive that stakeholder input. But that really is the basis of my presentation for today. Just wanted to get a few notes in front of the Board of Supervisors. I keep in constant communication with Krista. She keeps me focused. And so I'm doing what the board expects and of course what Krista administration expects. But I also would be remiss if I didn't say thank you to your board members. That is just not the case in every county, that all of you were very willing to sit down and give me so much of your time to talk about progressing the strategic plan, and also doing some great things, or hearing some great things from your county that really helps me as I go through this process shape those next steps. So I want to say thank you, and for making all of your staff available too.
Thank you, Mr. Bendorf. Is there any board questions or at this time? Oh, Ms. Callaway.
The retreat for department heads and board, is it two retreats or one retreat combined, department heads and board?
You know, it's done a little bit both. I mean, some, there's one, they do one retreat. It can be a little bit commingled, especially with counties, because you have elected officials, you know, that are department heads, and you have the appointed officials, and then the board members. And so it can get a little wonky, but I've also seen it work well together too. I don't know if I necessarily have a preference. What I'm used to is having the department heads together first, because it really encompasses that operational perspective, supervisor, and then having the board, it encompasses that 30,000-foot level, which is really valuable to compare and contrast the two, and then marry them together.
So what's the objective of the retreat?
The objective is to talk a little bit about leadership, sort of governance, that there's a common understanding of how these things work and how the product is delivered and how it is championed. And then there's a majority of it is how we develop priorities. So there are so many schools of thought, Supervisor Callaway, on is it one priority? Is it 3 priorities? Is it 5 priorities? Is it 10? And really a good understanding of those options available to folks and what they may think they believe it should be, but really the core underpinnings of strategic planning. Understand it first, provide some input, and then off we go.
So what I hear you saying sounds like it's really based on what the building blocks are of your strategic plan. And if we don't have a strategic plan yet, what are we going to be doing in a retreat?
Yeah, this is to build those blocks. So again, strategic planning comes in so many forms that I feel it's necessary, and part of my job is to let the board know, but also let your executive team know that, hey, these are the basics when it comes to strategic planning. Now you can pick different options, you know, whatever type you want from whatever shelf in the grocery store or whatever's on the menu you'd like, as long as there's some synergy, certainly amongst the board first, because you folks are driving that, and then amongst department heads. And I think there are some misconceptions, Supervisor Callaway, of what a strategic plan does. I would submit to you that it's been my experience that one of the misunderstandings is that it really is a guide of what we need to accomplish, but it's much more than that. It contains a set of values, or it should contain a set of values that are communicated throughout the organization, that provide sort of the day-to-day energy, synergy, and moving forward. But also that it's a living, breathing document too. Visiting it at one time, I mean, obviously this is the lengthy effort in building it, but visiting it at one time is not appropriate. Strategies and priorities should be visited amongst the board and the executive team and the entire organization on a more frequent basis. And again, having that direct interaction with department heads and board members, so everybody's working off the same sheet of music, is critical.
If I may, just to interject, so one of the things that I've heard from your board is that possibly to have some overlap where we discuss both with department heads and the board at the same time, and we're aware of that and working that into the process. So there will be that opportunity. Whether or not we choose to try and make that happen during the initial retreat is not yet clear, but we will certainly be, the whole point about this, just to put it a different way than Robert has, is for us all to come together and get on the same page. Clearly your board being the ultimate policy-making body, but making sure that that is a two-way communication from department heads to your board and vice versa, so that the plan really does evolve as the work product of all of us involved, including the external stakeholders and our colleagues here.
Well, on the slide, you talked about the working group, but a picture was covering who's on the working group.
That's yet to be determined. We have done a preliminary kind of assessment of who we think might be good candidates, but that's certainly something that has yet to be developed and would happen. I mean, we could. There are different ways in which we could arrive at that list, but I think initially what's being contemplated right now is to have that discussion with the Strategic Planning Committee and form that group on the advice of working with Robert, the entire committee, of which I'm a part, and obviously two of your board members, as well as the tax collector and the auditor controller.
I mean, I really like possibly having a combined retreat with department heads. I just don't think we're ready for it yet as a county. I think it'd just be a little bit awkward. We need to move into that direction. Bob mentioned the word governance. I think that's important to be part of our strategic plan. I'm not sure what that looks like, though.
Yeah, it can take a bunch of different forms. I can tell you for some counties that governance has taken a completely different form and meaning. But I think where I come from, Supervisor Callaway, is that governance is a true building block, like you had mentioned earlier, with strategic planning. I mean, there has to be coherence amongst the board somewhat in order for it to mean something and have that value. Some organizations may place quality governance as one of their values in a strategic plan as well. Or it can be set as one of the building blocks.
Thank you.
Thank you, Ms. Callaway. Any further board questions or statements? Ms. Fullendorf.
I was just going to say thank you for coming today and giving the presentation, and Krista working with the committee to get this to the Board of Supervisors today. We felt like it was important to give you guys an update of what we've been discussing at the committee level and know basically what we know and how far along this process is. We recognize that there's going to be not immediate answers, and that's part of the evolution of the strategic plan. Its intent is not really to make quick and reaction change, but talk through evolving not only as how the board governs, but just the organization as a whole, and what is the goal and vision of what we want the county to be like. And that is bringing in, when the time allows it, staff, both appointed and other elected heads. So we're all in it essentially together. So thank you for your guys' work on this and time.
I also want to say thank you. I look forward to the steps as we move forward. I'm optimistic personally that we can move forward with the strategic plan. And I look forward to working with staff and the county as a whole to find our direction. So thank you, Mr. Bendorf, for your time. Any further? Mr. Jeremy.
I just add my voice to the chorus. I'm glad you're here and I'm glad we're doing this. I think this is actually getting ready to be in the scary part of this. We're going to start putting stuff down on paper and seeing how it all matches. And that's a lot of exposure and a lot of vetting. So I think it's going to be, I would say this is exciting / scary part of the process. But it's going to, we'll come out on the other side much better. Thank you.
Mr. Chairman, if I may, just one last comment. I know I...
Absolutely, sir.
Thank you. I know I thank the board already, but really to the board and the department heads and administration, I kid you not that it has been a really good experience. And there isn't one interview that went south. There isn't one piece of, or one directional item from the committee or the board or from administration that has seemed odd or contrary to accomplishing something as big as strategic planning. And it's just been just a pleasure to work with all of you, get to know you a little bit, and also the organization as well. I just want to say thank you. It makes my job a heck of a lot easier when that happens.
Well, someone must have fixed the water here because that's extraordinary for Calaveras County. Thank you, sir.
Yeah.
With that, if there's no further... Absolutely, Mr. Oh, public comment. I'm going to take public comment real quick. Thank you, Mr. Toffanelli. It's been quite some time since I messed that one up. It's because I got my other sign in front of this one. Okay, public comment.
There's no online public comment?
Doug, you got anything for this? Reeling you in.
You called me out, so I'm here. No, I just want to say that I've met with this individual, as every department head has, and I am familiar with these processes. I was involved in one a few years back. They're incredibly important and they're incredibly helpful, and it feels like we're on the right track here. I'm very excited to be part of it, and so at any level, if this organization needs my assistance or my input during this process, our department is standing by.
Thank you, Mr. Oliver. Well, you have a good day, Mr. Bendorf. We appreciate your time.
Thank you very much.
Safe travels.
Thank you.
2 minutes, Ms. Callaway. Just 2, not 3? Welcome back. We'll move to item 24, informational item, Administrative Office. Receive an update regarding American Rescue Plan Act funding. Ms. Krista Von Lotta.
Mr. Chair, members of the board, good afternoon. Krista Von Lotta from the Administrative Office. I wanted to give you a brief update on the American Rescue Plan Act funding that I know you are all aware was awarded to the county this past spring. We did, in fact, receive an allocation direct from the federal government in roughly the amount of $8.9 million. We received the first 50% of that allocation in October of this year and anticipate receiving the second installment in the same amount approximately, let's just say, fall of next year. So when we originally did our assessment of the funding and the allowable uses, the broadest allowable use is where you can demonstrate, where we can demonstrate revenue loss. And so having since done that calculation and take that deep dive, we believe that we can in fact justify that revenue loss in the entire amount of $8.9 million. As a parallel issue, there is a bill that we can. Can. Yes. Indeed. No. So, kind of on a parallel but related course, there is legislation that originated in the Senate, and I want to say, yeah, it was October. It passed by unanimous consent on the same day, and it is a more flexible plan than ARPA that is intended to further broaden the scope of allowable uses for ARPA funding. However, given that one of the allowable uses, even under the original act, is for where there's lost revenue to be able to use that lost revenue for governmental services. And by virtue of doing that, then that very clearly broadens where we might be able to spend those funds. So, for example, safety is an allowable use. So we could be looking back at all of our safety-related activities and backfilling our lost revenue on the basis of those activities to then free up those funds to use in other ways. We also could use them prospectively, or going forward rather, in terms of other safety-related activities. So further to board discussion on what I hear from you today, what I'm really here to propose, bringing back to your board after the first of the year, are recommendations for capital projects. We know that we have had, for example, animal services and a district attorney building slated to be completed for some time now. We are aware of at least one other safety-related project that should be addressed at some point in the reasonably near future. There are some additional items that we could look at incorporating into those existing priorities that the board has set forward in the last couple of years. And the overall general recommendation of mine is that we take this as an opportunity to do some large-scale projects that will carry the county forward. We address some of the infrastructure needs that we've been aware of for, in the case of animal services, more than 2 decades, and actually for your board to direct me to come back with those recommendations after the first of the year. While I am not opposed, and it is certainly within your policy-making decision to direct me to come back with other types of recommendations as well, I'm quite happy to do that. However, my recommendation is to focus on 2 or 3 large-scale projects and look at other ongoing or other one-time funding sources for some of the other initiatives that you might like to achieve. That said, that is completely within your purview to make those decisions and give me direction, and I look forward to hearing your feedback here.
Thank you, Ms. Von Lotta. I'll start out with public comment, and I'll bring it back to the board.
There is no online public comment.
Excellent, thank you. Any questions or statements by board members?
I'll go.
Ms. Callaway.
I seem to be going first this meeting. I totally support the idea of the large capital projects. I mean, this is an opportunity we've never had. And we're always looking for ways, how are we going to fund the DA's office? I mean, we can all go in there and jump up and down and the floor falls. And we've talked about it for years since we moved them from here to the trailer. And to do something for them, and of course, my favorite, animal services, that we will not have this opportunity for, if ever, again. And then it's something that the county can use for many years going forward. I mean, we can whittle it away on little feel-good things, but I think we need to, I would like us to support making a commitment to the large projects that you recommended, large capital projects. Less money we have to borrow, less money we have to figure out how we're going to pay for it. Oh, let's put it off another year. And here we are 5 years down the road and there's nothing. Thank you.
We can call it the Callaway Building.
You can call Animal Services that. I'd be honored.
I concur with Ms. Callaway. Big feel-good things, not little ones. And one-time expenditures, one-time funds. You know, what that looks like when we get to it, you know, we'll see that when it comes back before us. So there'll be a time for a debate on which big feel-good things those are.
If I may, and I was remiss in my introduction not to mention this, but when Robert and I spoke last week and had our debrief over strategic planning, one of the themes that came not just from the board but also from department heads was the need for us to address large-scale infrastructure as a county. And I think that from every possible perspective, but not least of which would be making our staff and our colleagues, our department heads, and the clients that we all serve, your constituents, see us building something for the county and them, and that the pride that comes with that, and the ability to watch that progress will be hugely important for morale, and I think that will have a lot of cascading positive effects that we'll see over time.
Excellent, thank you. Mr. Garamendi.
Thank you, Mr. Chair, and thank you, Krista. I agree with Ms. Callaway and Mr. Stopper that, you know, this is a one-time thing. We may never have this kind of opportunity again. I would like to, and I support things like taking on animal services, the DA building, things that have been on the list far longer than I've been on this board. I would also think that we ought to add to the list for discussion things like setting aside a certain amount of revenue for internet for our county. We don't know what that's going to be. We know there's all this federal. My guess is that there's going to be some match required at some point, and if we don't use it, we can always deal back in. But one of the things I want to talk about is, you know, this has been a public health crisis that we've all gone through. I think we have to include public health and health and human services at this time. We've got a small chunk of money relative to their needs, but it's a good down payment. And I think we need to start thinking about how we can house them adequately. They are the ones who carried a lot of us through this, and we have to recognize that they're not going to be the last battle. We're going to have to fight health-wise.
Supervisor Garamendi, I could not agree with you more. I will say that on a related track, we are looking into specific recommendations for health and human services to the extent to which we might want to have that conversation at the same time. We have set the groundwork so that we can have the discussions we need to have with consultants in order to see what that might look like. So that is certainly something that we are considering, and that we'll bring back to your board so that you can actually take a full look. But I want to be really clear, and I want to give that conversation, at least so far as it's been contemplated at the admin level, is one that is more or less construed to be a separate standalone project, and there are a lot of reasons for that that I'm not yet prepared to discuss, but that are related to funding and the vehicle that we may use in order to have that in place to get that project accomplished.
I just want to get it in front of this board as a possible future capital project.
Yes, absolutely.
And this may not be the right vehicle, but you know, I have to admit that it really bothered me that with all these billions of dollars from the state, we're not rebuilding our public health departments physically or staff-wise. It's like it didn't happen, and I feel for them.
Ms. Fullendorf.
When we're talking about infrastructure, are we also keeping in mind technology infrastructure and expanding accessibility in terms of one-time cost to get things up to date where the public can easier access or pay bills online? I'm thinking as simple as dog tags, you know, just some of the small things that to update and make employees' jobs easier and make the public feel like they have the access to get some of these things done rather than having to worry about coming into the facilities to get things, even for plans, like uploading plans and that in the background. I know there's revolving costs going forward, but the initial setup, I mean, if anything's taught us this last couple of years, is just the access of and the lack of infrastructure and accessibility to government from the public. I know we still need the broadband issue, but I'd like to make sure that that's also in the back of the mind of when we're talking infrastructure, it's just not a concrete. There's a lot of other infrastructure that goes under that. And not the millennial in me, so I guess so.
No, I mean, I think your point is well made. You know, I think the first step there, and this is certainly something that I imagine we'll be speaking about in connection with the strategic plan and generally just outside of it in terms of government operations. But we have many of those initiatives already in place that are not fully deployed, but that are there. So I think the first step would be to take a true assessment of and see where we have opportunities and what's the low-hanging fruit. We know, for example, that Trackit has been largely implemented, but there are still departments that have not yet onboarded that technology. So I definitely agree that there's opportunity there. And it's up to your board to, you know, determine how much time or how much of the funding you'd like to potentially allocate to that.
Mr. Toffanelli.
Well, I think all the projects that were mentioned are good projects. I think, you know, the animal shelter and the DA's building, Marita's correct, it's been on for a long time, and it certainly needs to be dealt with. It'd be nice that we have some money to do it. However, there's so many projects that are in the same area that's been brought up, but we have another issue that I think needs to be talked about and thrown in, and the amount of cost I don't know at this time. Patrick is supposed to be getting somewhat of a handle on it, but it's been a long-standing issue since it's opened, is the jail, and to rectify the problems with that jail. We're talking about flooding that annually happens, and I'm sure it happened over the course of the weekend and yesterday with the amount of rain we had. We have officers in there and inmates in there working on floors that are flooded, and sooner or later we may have a major incident in there that we've known about. and it kind of opens ourselves up a little bit. So I think we really need to put that into the mix too, as soon as we find out how much it's going to cost to rectify the issues that we have there. I mean, that money could be recovered at some point, if it's not too long down the line, through some suits that could go on with the contractor. But it's another major issue that we keep talking about, but it doesn't get done. So I think we need to also think about that and at least talk about it going forward. But the DA's office and the animal shelter and broadband and the other projects that are brought up, certainly we could do. And I wanted to just bring up one other issue, that if we're talking about infrastructure, and it depends on the board whether it wants to talk about it or not, but it's a major safety issue as far as evacuations, and it's something that, again, has been a long time in the county. That's the wagon trail project. We've funded phase 1 of it, but we have a phase 2 coming that we need $4.5 million to get the plans ready for shovel ready, so we can ask for funds. Until we have that done, we can't go to the state or federal governments and ask for money, because we don't basically have a project funded. But once that highway opens up completely, we have a straight run to Alpine County from our end of the county down here with a nice updated road. It's going to bring many people into our county, which could increase the tax dollars tremendously just about now, because people avoid it. They don't go skiing up to Bear Valley because of the dangerous roads that we have between Copper and Angels Camp. We've improved both sides of it, but this needs to be done, and obviously phase 1 we've funded and going forward. But it just needs, I think, to be in the mix to talk about, because it is another long-standing project. So those are my comments.
Thank you, Mr. Toffenelli. Any further board questions or comments? Krista, anything further? All right, you got your notes?
Got my notes.
Very good. Supervisors' announcements. In compliance with Government Code 532323.3D, board members shall provide brief reports on any meetings attended at the expense of the local agency, and may make other announcements or report out. Ms. Callaway, since you're used to going first today. Mike, please. Sorry.
I'd just like to remind all of you about, we have a Christmas Day, free Christmas Day dinner for the community. We'll be doing pickup in San Andreas at Treats, Native Sons in Murphy's, and dine in at the Native Sons, and we also deliver anywhere in the county. So if you have any, it's a community dinner, and welcome your participation or any of your constituents. And NAMI is having a opening, an invitation on the 29th of December. So at least one or two of us can go, that would be great. Thank you.
Thank you, Ms. Callaway. Mr. Garamendi.
Thank you very much. Nothing to report, but I do want to, Mr. Chair, this is this is your last full meeting. Good job this year. I'd like to wish my colleagues a good year and a Happy New Year and Merry Christmas to everybody. And that's all I got.
Thank you, Mr. Garamendi. I want to wish staff, the public, the fellow supervisors a Merry Christmas, Happy New Year. You know, for many of these are hard times. You know, I just want everyone to think of your family, hold them close, let them know how much you care, get over past trials and tribulations. It's an important time. We need to support all our family as much as possible, and I wish everyone the best. Thank you. Mr. Toffenelli.
Thank you, Mr. Chair, and I echo your sentiments, and Merry Christmas to everybody and staff. Hopefully, going forward, we have as good a year next year as we had this year. I echo Jack's sentiments about how well the board worked together this year and a good year that we had. Doesn't happen that often. We will have the same board next year, so I look forward to the projects and things that we get accomplished next year. I want to bring up, I have a Mountain Valley EMS very important meeting this Thursday at 10 a.m. Again, we have Stanislaus County withdrawing from that JPA. They're a major stakeholder in it. The other 4 counties are rural counties: Alpine, Mariposa, Amador, and Calaveras. We're getting close to the time where they're going to be pulling out, and this will be a planning meeting to plan on that exit and going forward. We'll have June 30th is their exit date, so we have a short 6-month time period to get everything on track. So it will be a planning meeting on Thursday. I will report on the 11th on that meeting.
Thank you, Mr. Toffenelli. Ms. Vollendorf.
Echo what everyone else has said about Merry Christmas and a Happy New Year. Thanks for making this first year for me easy. I appreciate each and every one of you helping me through. This last week, Supervisor Toffenelli and I attended the Eastside GSA meeting, and we will be bringing back, hopefully sooner than later in the next year, a report back to the Board of Supervisors regarding the GSA. And that's all I have.
Thank you. See you all next year. Some of you sooner.
Good year.